can, because I'm present here and I'm just, you just need to open it, yes.
To have it open and then to we just use the arrows.
We don't have clicker.
No, it's okay. It's absolutely fine.
Okay, that's, yes, maybe it's,
My worry is that this is in between and maybe it will ask me something that I will not know how to answer. So I appreciate the help.
this one.
Opening the presentation, yeah? Okay.
Yeah, that's okay. That's it. Viens, du trīs.
Let's test the sound. Good morning.
I'm just checking if everyone is inside. It's not, we don't want to leave anyone behind. It's not, the train is going. Okay. So, good morning, everyone, and welcome to the conference for men's emotional health towards support and well-being. I am Dainius Jagučionis. I will be moderating this conference and also panel discussions. I was invited as a psychotherapist, and then they said, okay, you will need to be moderating. And I said, oh, moderating, that's nice. And after some days, and yesterday I was thinking, there is a lot of smart people here, a lot of very high people in government and also in other countries' organizations, and like, how it will sound, do they understand me? So I was very nervous, but I have the trick. If you say that you are nervous, the anxiety goes away. So that's, now I'm okay. And let's begin with one sentence. This conference aims to address the crucial topic on men's emotional health and the need to break down stigmas associated with it, fostering safe spaces for men to openly discuss their problems without fear of judgment. So this sentence was in the invitation letter of the conference, and I think that it greatly summarizes our aim and goal here, what to do and how to do it. And we will talk openly about how to improve men's mental health and emotional health and also well-being. And also we don't forget gender equality as well. Conference is organized jointly by the Ministry of Social Security and Labor of the Republic of Lithuania and the Nordic Council of Ministers Office in Lithuania as a part of project Strengthening Services of Men's Crisis Centers, men's organizations and competencies of their staff in Baltic countries. Whew. It's a long one. Okay, some technical stuff. We are live streaming all the conference to the YouTube in English and to Facebook also in Lithuanian and translating directly. So for those who are in the venue, feel free to ask questions during the panels, and if we will have time, I will see you and we will try to answer those questions. Those who are online, you can comment. Leave the comments below the video, and after the conference we will decide who from the panelists or who from the organization will answer them, just because we don't have a possibility to answer them directly. So that's all. And also for those who are online and those here, be polite, don't comment disruptive comments, and we're all here to support each other, and we have one goal, so just be about that. And about the agenda a little bit, We will have first part till the 12:30. Then we will have lunch break. Second part will begin 1:15. And then till the late evening we will have discussions, networking, parties, and etc. Kidding, just joking. Okay, my part is over, and I want to invite for welcoming speeches two persons. So first I would like to invite Vice Minister of Social Security and Labor of Lithuanian Republic, Justina Jakštienė.
Good morning, dear colleagues, dear partners, dear friends, and all the international organizations who are funding this project, this event, and actually creating the reason to meet us all together, creating the reason and the circumstances to create the methodologies, to share the experience and just shift forward our country, or in general Baltic states, one step forward in the policies, in social policies, together with health policies and educational policies and regional development policies and all other policies in the country. As men's emotional health, actually, I would see this topic as a horizontal topic in the governmental level. Of course, it's part of social security, but in general, we are absolutely overlapping with education system, with health, with, as I said, regional development, with finances or fiscal policies, and a lot of other policies. If we would talk on this not interesting topic as a policy in general. But actually, on behalf of our minister, Monika Navickienė, I'm just really happy and sending you all the best wishes from her. As the topic we are talking today, in general, men's emotional health is one of important aspect, and our governmental program. As you know, each cadency has a governmental program to acquire. It's the first time in Lithuanian's history we have the special measure in our governmental program for men's health, men's emotional health, and creating the special methodology or system or partnership in the country. And of course, as a demographer, I would see this topic as a scientific demography topic, which is, again, absolutely horizontal topic in the country, because men's emotional health impacts the life expectancy, and a lot of other vulnerable topics when we actually count the years of people who are living in Lithuania and creating our country altogether. Later in the panel, I'll show some statistics or data, how we can understand the impact of the men emotional health to the life expectancy, to the other indicators in the country. Of course, it's gender equality topic. And sometimes gender equality is understood as a feminist or woman or other not men aspect. But in general, gender roles are really on the table here. So during the Sweden presidency that we have in the first part of the year, I'm really thankful for Sweden presidency and for Sweden government that we actually had the gender equality and men emotional health topic in the schedule. And during this participation in Sweden presidency events, we already got some experiences and practices and some policy information that we can apply in Lithuania. So today I think we will again share more practices or practices on the ground, not only the policy but the real practices. How can we include the system, and how can we change the situation we are now? And finally, I would like to be really grateful, and I'm really thankful for our NGOs who are really active here in Lithuania and brave. And really, I'm happy that they are stepping and putting this question on the table. I would like to hear more and more questions, more and more proposals. As you know, question is only one part. We have to shift to the proposal and work together, changing the situation. So from the indicating of the problem, we have to already think how can we change? What would be the proposal? Do I see the whole situation? Do I see only the capital, or maybe I see the regions, or maybe I see different age groups, and etc. So we have a lot of demography questions or sociological questions here. So I really wish today a really good event, and I'm sure that we're having a lot of good discussions and good meetings, and I would like to have a lot of contacts that all organizations are here for the future cooperation, as our ministry are already funding a lot of projects in this topic, and we are looking forward how to develop the policy and to leave to the other governments some structure that could have more sustainability in the future. So thank you very much. I would like to be short and looking forward to the panel and other discussions.
Thank you, Vice Minister Justina Jakštienė, and for this optimistic and I think promising, I hope that promising welcoming speech for the Lithuanians and also for, okay, just for Lithuanians. So. And next one I want to invite Karen Element, Secretary General of the Nordic Council of Ministers.
Well, thank you very much. Thank you, Vice Minister, and dear colleagues, dear friends. Let me just start by thanking the Ministry of Social Security and Labor in Lithuania, the Nordic Council of Ministers office here in Lithuania, the European Institute for Gender Equality, and the British Council for organizing and hosting this conference on men's emotional health and well-being. I'm actually very both grateful and also very honored to be able to be here and welcome you and speak about this topic, because men's health and men's mental health and well-being is one of the focus areas for the Nordic Cooperation on Gender Equality, and we need to address the perspectives particularly relevant to men when we discuss gender equality. And we also need to make sure that men and boys are involved and engaged in working for gender equality. So I find this especially important at a time when we actually are seeing a rising gender opposition in Europe. As Secretary General of the Nordic Council of Ministers, I represent the official body for intergovernmental cooperation in the Nordic region. And the cooperation was established back in 1971, actually after I was born, so it gives you kind of a perspective, but back in 1971. And the Nordic Council of Ministers actually consists of several individual councils of ministers, including the Nordic Council of Ministers for Gender Equality and LGBTI. The Nordic Prime Ministers have adopted a vision to make the Nordic region the most sustainable and integrated region in the world by 2030. And this requires a continuous focus on gender equality and the equal rights of women and men, and the rights of LGBTI persons. Gender equality is a goal in Agenda 2030 and prerequisite for integration. For nearly 50 years, the Nordic Ministers for Gender Equality has worked to promote gender equality. The overarching goal of this collaboration is to see a gender-equal Nordic region. The work is in line with the progressive Beijing Declaration and Platform for Action that was adopted by 189 nations. I mean, basically the whole world. It was adopted back in 1995. And this platform has since served as this gold standards for women's and girls' equal rights, and the Nordic countries continue to strongly support its full implementation. With reference to the Beijing platform and other important instruments, the Nordic region has moved far towards gender equality through legislation and policy measures. However, our region also has much to do before all women and men, boys and girls, have the same power, the same influence, the same opportunities in society. Back in 2020, the Nordic Ministers for Gender Equality extended their cooperation to include equal treatment and equal rights for LGBTI people in the Nordic region. The LGBTI cooperation focuses on freedom and openness, on quality of life and living conditions. The cooperation explicitly supports networks and social society, and, importantly, it applies an intersectional approach. It is often said that the Nordic context, that gender equality can only be attained with the participation of men. And since 2019, the Nordic Council of Ministers for Gender Equality and LGBTI has prioritized gender equality work with particular focus on men and masculinities. The Council has worked to challenge restricting norms and gender stereotypes. Changing norms brings both advantages for the individual and gains for society as a whole. And this may involve a greater sense of security, improve public health, and reduced violence. The Cooperation Program for Gender Equality highlights that men must be included and seen as important drivers for change. Notions of gender that affect and restrict women also affect men. And when these notions are challenged, both women and men have greater freedom and more opportunities. In the Nordic region, men have more power, own more, have higher income than women. And women still have the main responsibility for unpaid work, unpaid homework and care work. At the same time, the perception that men must be strong and independent make them vulnerable. Men, for example, do not seek treatment or help to the same extent as women, particularly in terms of mental health. Boys have worse results in schools, and men both perpetrate and are victims of violence. Several projects and activities have been initiated to address men and masculinities, and allow me just to mention a few. One of them is called State of Nordic Fathers, and it was a comprehensive study that launched 10 key findings revealing that fathers' involvement is a key to gender equality. The study was based on a survey capturing the attitude of 7,500 Nordic men and women on childcare work, on parental leave, on masculinity norms, and workplace and family relationships. Another example is that back in 2021, men's organizations gathered for a conference in Helsinki on Nordic fathers on parental leave, with the goal just to promote and normalize fathers' participation in parenting. And last year, a research review on young men's mental ill health was commissioned to provide knowledge on causes and consequences in a lifelong perspective. And then finally, this joint Baltic project with this catching title, I totally agree with you, but still a title says a lot, because strengthening services of men's crisis centers, men's organizations and competences of their staff in Baltic countries. Yes, it's a long title, but it's really, really important content. So this is implemented by the Ministry of Social Security and Labor in Lithuania and the Nordic Councils of Ministers' Office that we will learn much more about throughout the day. So this conference today is the final milestone in this huge project that was made possible due to the close collaboration between Nordic and Baltic countries on gender equality. It's a framework agreement for cooperation, and it was signed by all our gender equality ministers in the Nordics and in Estonia, Latvia, and Lithuania in 2017. So this is actually a Nordic-Baltic cooperation with a good, long, strong history. And since then, this collaboration has resulted in Nordic-Baltic ministerial meetings and meetings between governmental officials and in conferences such as the 5th International Conference on Men and Equal Opportunities, the ICMEO, that was held in Tallinn in 2020. Because the general aim of the ICMEO conference was to involve more men in promoting gender equality and to find ways to tackle gender-specific challenges that men face. Issues such as responsibility for self-care, care for others, and care for well-being and sustainability of societies, as well as gender norms, was addressed. So these examples, and numerous others, shows the value of strong partnerships and the cooperation between regions where our goals and our challenges are similar and where we can foster the change together. So I really hope that this conference today will lay important foundations for the work ahead to break down stigmas surrounding men's emotional health, to strengthen services and support for men in both our regions, and in building a stronger network of men's organizations. Thank you very much.
Thank you, Secretary General Karen Elleman. And one more welcoming speech. I will warmly invite Dominika Umbrasaite from British Council.
Dear guests, it's my pleasure to welcome you all to this conference. This is a remarkable initiative jointly undertaken by the Nordic Council of Ministers Office in Lithuania, the Ministry of Social Security and Labour of Republic of Lithuania, and with the contribution of the British Council. The British Council is a global organization that works in various areas, including education, culture, and human rights. British Council builds its foundation in the areas of social cohesion, mutual understanding, and recognizes the significance of both gender equality and mental health. We promote this through our diverse projects and collaborations. All over the world, the British Council vastly supports gender-focused initiatives that challenge gender stereotypes, which are still prevailing in many areas, including arts, culture, and education. We also work to raise awareness about mental health issues, reduce stigma, and promote emotional well-being by supporting initiatives that provide mental health education, training, and resources to individuals, particularly in the context of education and cultural programs. In these areas, the British Council often collaborates with local partners, governments, and civic society organizations to maximize the impact. By incorporating gender equality and emotional well-being awareness into our programs, we want to contribute to build more inclusive and equitable societies, foster dialogue, and create platforms for knowledge exchange on these important topics. Raising awareness about men's emotional well-being is an important topic that has gained increased attention, especially in recent years. Historically, societal expectations and gender stereotypes have often discouraged men from openly expressing their emotions or seeking help for mental health issues. However, it's crucial to recognize that every one of us, no matter of the gender, can face significant challenges to our mental well-being. By raising awareness about men's emotional well-being, we can foster a culture that supports open dialogue, empathy, and mental health promotion for all. Recognizing and addressing the unique challenges they face can, and I'm sure will, contribute to improved emotional well-being and overall quality of life. Once again, I extend my warmest welcome to every one of you. May this conference be a testament to our shared commitment to nurturing the well-being of all individuals. Thank you very much.
Thank you, Dominika. And now we will have first keynote speech from Alexandrina Satinoianu from, I'm trying, from European Institute for Gender Equality, and she will talk about men's and gender equality. Yes, even I don't understand Lithuanian.
So, thank you so much. On behalf of the host, the European Institute for Gender Equality, I'm really happy to be talking today about men and gender equality. I've met some of you, representatives of men's organizations, and we talked about the work that you do, and I hope that an overview of the work that we do would allow us to meet somewhere in the middle and open up partnerships. I will start by a look in the past. Every year, the Institute is choosing thematic focuses to work on. Violence against women is one of them, and this year is the Green Deal and gender equality. So as a coordinator of the information campaign on the Green Deal and gender equality, I became more curious about our green behaviors. And I don't know, maybe you are passionate about cars or history, and this doesn't come as a surprise to you, but beginning of the 20th century, 1/3 of the cars in Europe, they were electric. Actually, in 1908, as you can see, Clara Ford, the wife of Henry Ford, the famous inventor of the motor car, was driving an electric car herself, produced by another company instead of the popular Ford Model T that her husband was producing. So why Clara was not actually driving her husband's car? It's because at that time, electric cars were considered to be for ladies, and men were distancing themselves. Men were driving petrol cars. And this is where the problem starts, where gendered behaviors become gender stereotypes and lead to gender norms. And yes, as we have heard, the gender stereotypes prevail. We have a special Eurobarometer from the 2017 on gender equality, and it has a special section on gender stereotypes. And I'm only putting here two of the questions that were asked for all Europeans, so respondents were from all over Europe. And you can see that we still have high numbers. Do not focus on the numbers. I will be showing you many numbers through my presentation, and you can find them all on our website. But the idea is that we still think that the most important role for men is to earn money, and the most important role for women is to take care of her family and home. That's why the European strategy for gender equality that is currently in place starts with number one objective, make Europe free from violence and gender stereotypes. So the work on gender stereotypes is really at the forefront. And then there are some other objectives, closing the gender gap in employment, closing the gender pay gap, so going into the direction of having a gender equal economy, having more women in decision-making in the companies and in politics, using gender mainstreaming as a strategy for reaching gender equality, and of course, funds and resources. And since the gender stereotypes are #1 objective for the EU, beginning of this year, European Commission has launched a campaign, and gender stereotypes is the hashtag. You can find information about it on social media. And this is because gender stereotypes actually take away our freedom, and it's important to tackle them. And these have been the areas in which we should be working more. Career choices, work-life balance, decision-making. Aligned with with the objectives from the strategies, from the gender equality strategy, the Institute has developed the Gender Equality Index. It measures gender gaps in several domains: work, money, knowledge, time, power, and health. And the Gender Equality Index, every year since its launch in 2013, calculates a score for the EU and for each of the member states. We are currently at 68.6, and at the current progression rate, we will be reaching gender equality in 60 years, which is not very comforting. Separate from the core domains, we are also looking at violence against women, but there we are not looking at gaps between women and men, which is what the Gender Equality Index does, but we are actually looking at how violence affects women, which are the types of violence, and what can we be doing to dismantling it. Of course, I'm talking about women and men, but the reality is that we are not homogeneous groups of women and men, and that's why the intersecting inequalities also looks at different groups that are calculated based on family type, level of education, country of birth, age, and disability. So by looking online at the Gender Equality Index, you can be observing how inequalities actually range with this or within these groups. But the Gender Equality Index also is instrumental for revealing areas in which men are disadvantaged. And I will start here with men spending long hours at work, because we have seen from the Eurobarometer that it is still an important role for women to take care of home and family, which means that it's an important role for men to be the breadwinners. And it's especially interesting that in couples with children, we have the highest rate of employment at 88%. And this is also visible when we are talking about long hours at work, which gives them very little time to spend at home with their families. And 1/3 of European men and women say that caring activities, when it comes to caring activities, they experience difficulties in combining work in most days. Work-life balance, we have seen, it is an issue. But somehow, also coming from the Eurobarometer, it shows that this is not what men think that is an issue of equality at work. Yet, it is for women. It's keeping women away from work, the care responsibilities. 82% of all part-time workers are women, and this is something not very easy for men also to take on board, because when it comes to eligibility for parental leave, we see that 23% of men are not eligible for various reasons, and these depend on each of the countries. It might be that they are not working at all, it might be the length in service, or they might be self-employed. So this makes them not eligible. Overall, because we are talking about women and men in relationships. So the situation that affects men also reflects back on women, and the situation that affects women reflects back on men. This means that women spend more than 30 hours per week, extra than men do, on unpaid care and housework. We've heard about men's health. It is a concern. And expressing emotions, I've talked with some of you yesterday, and learning how to deal with emotions is at the forefront of the organizations that are focusing on men. It's still not acceptable. Where it is for a percentage of women and men, but there is still a high percentage of women and men that do not accept expressing emotions, or they think that this is something men should not be doing. And definitely holding up on these emotions creates problems. 4 times more men than women are likely to die of alcohol abuse and drug dependence. And this overall leads to fewer healthy life years. Life expectancy is of 84 years for women and 78 for men. This leads us to thinking that boys would definitely benefit of gender-sensitive education, as would girls. And we have a question in the Eurobarometer where we see that not so many men would be responding positive to it. 54% of women would approve of a man identifying himself as a feminist, yet 45% of men will only do it. So it means that we have some work to do there. Teaching both girls and boys how to deal with gender stereotypes, how to react on them, how to support each other. And I can give you the example because I am passionate about STEAM education, and the studies clearly show that girls who go towards this path, studying math and science, they accept or they expect the acknowledgement of their peers, of their colleagues in class. In the same way, when we are talking about non-stereotypical career choices, we see that very few men actually want to go towards programs studying education, health and welfare, humanities and arts. So it means that fewer men end up teaching. It might be creating problems for younger men, which we can also see that many of them leave school early. In terms of continuing about boys benefiting of gender-sensitive education, it comes to the very difficult topic of aggression. Here in its slightest form. So there was a question in the Eurobarometer whether women or men should be approaching friends on a sexist joke. And we see men being more reluctant to do it. So this is also an issue when it comes to the whole range of aggressive and violent reactions. It's true that men are more commonly victims of violence at the hands of another, most often unknown man, but it is the reality that women are experiencing violence at the hands of an intimate partner. So here, when we are talking about gender-sensitive education, going in this direction of zero tolerance to violence, it's definitely a point we should be stressing. Again, the percentages of women suffering from psychological violence from a partner throughout the lifetime are quite high. coming back to the beginning, where we've seen that technology is gendered, and we have gendered reactions. We are nowadays faced with the climate change challenge, which requires both men and women being involved in finding solutions, bringing forward innovations, and maybe one of the innovations we could be considering would be changing the attitudes. Because unfortunately, gender stereotypes are here valid as well. And I can give you some numbers. There is an eco-gender gap. For example, 57% of women and 48% of men report being mindful of their consumption of natural resources every day. So there is a gender gap in our green behaviors. Men are more reluctant. Maybe talking about and tackling the gender stereotypes would help us change such a behavior and finding a solution in which we are all, women and men, involved. The topic of Green Deal and gender equality will be further discussed. As I said, it's a thematic priority for us. The Gender Equality Index will be releasing findings, so stay tuned. On the 24th of October, you will be hearing more. This is what I had to say in a nutshell. Of course, the nerves were still here. I didn't acknowledge them at the beginning, so I guess that's why. These are our communications channels, and I hope that some of these findings and the stress that I've put on gender stereotypes will be kept in the conversations throughout the day, because tackling gender stereotypes is important. They are the roots of all evil. So thank you so much.
Maybe there is a question from the audience. Maybe someone would like to ask something. No, if you think I will ask them. Maybe as Alexandrina can say that what is the one, maybe the most, the biggest reasons why there is this gender inequality?
Gender inequality?
Yeah.
Well, as you have seen in the index, there are many reasons. So we are looking at the gender inequalities in various domains, from the work that we are doing and my personal knowledge as a gender equality expert. I said it's the gender stereotypes. So we have to prioritize them when it comes to education. We have to teach both boys and girls to recognize the stereotypes, not to accept the gender norms, to free themselves, and to find the ways in which they want to express themselves, but of course, in a supportive, non-violent way. We are talking about finding solutions for building partnerships, for being together, men and women in gender equality, not being polarized at the opposites.
Okay, thank you. Maybe now there's one question. No? Yes? Okay. No, that's
Thank
no.
you.
Okay, now we will have panel discussions, and thank you, Alexandrina, for saving time. We will have more time for discussions, and I would like to invite first panelists to sit in this half circle, and then I will ask you to do something. So please come, and I will introduce you when you are here. Yep. I will take this one just to be, see you all. Please come. So, okay, everyone is equal, then I also will sit. So here we have, as you saw, also Vice Minister of that's the very long name in English. The Vice Minister of Ministry of Social Security and Labor, Justina Jakštienė. Thank you, thank you, thank you. Like, we need to have a little bit of encouragement. Also, here we have Alexander Anderson from Kvinfo, Denmark. Yeah, you see, it's nice. It's nice to feel this applause. Ieva Juchneviča from Ministry of Welfare, Latvia. Bo Helsing Young Men's Clinic, Sweden. And Christian Veske, Gender Equality and Equal Treatment Commissioner from Estonia. So the panel discussion will be with a little bit formalities, and then we will chat more. First of all, I will ask panelists to introduce themselves and present a little bit about their organizations, and then we will come back here and talk about men's health issues and welfare and well-being and etc. So we can do it in the hard way or in the easy way. Easy way, you can decide by yourself which one is going, and the hard way, I will be deciding. Okay, you see? Thank you, Justina Jakštienė. So let's come. Do you have presentation? Yeah. Okay. So Justina Jakštienė will present few slides.
Okay, a few slides, as it was just requested on, that's okay, on where we are with Lithuanian policies on emotional health services for men. As I said, we are in the first steps. Someone could say we are in the first baby steps, but still the most important thing, of course, is to move forward and to set in the policy the sustainable aims and targets and create the impact on the ground, as I say, because the policies are just policies, but the impact is always the most important. So the situation where we are now is I'm not sure if you know, or maybe not, some information that, of course, compared to women, men are less likely to seek help for mental health difficulties. And it's not only mental health. We see, together with Ministry of Health, that men are less participating in just health prevention, any programs that we have in Lithuania and, of course, in other EU countries, because in certain age, all of us have to just check for health prevention and make some procedures. So in Lithuania, of course, men less likely to come to the doctor, less likely to check the health, less likely to go to any health system until there is a huge, impossibility to work and to step out of the bed or some health heart problems occur. So it's not only mental health context, but in general health context. And of course, men are more likely to commit suicide than women, and I would say they are more likely to be aggressive against himself or against others. And it's not only about suicide, but in general aggression that could be in different forms. And as well, the aggression could be as an alcohol abuse or other dependencies and etc. So, of course, it's a few worse in Lithuania, but in general, I would comment that life expectancy, men and women in Lithuania, is biggest in European. The difference is biggest in European Union. So, Men and women life expectancy today is about 9 or 10 years difference. Just because the mortality of men are in younger age groups are really high, and I'll show in the next slide that the mortality level in men groups, not only just because of the suicide, but just because of the consumption of alcohol, drugs, and other behaviors as well. Of course, suicide rates in Lithuania are really high as well, and the problem we see, blue columns, is of course in the men groups. And in the tendencies in the year, we see that it is decreasing in the men group and in the women group as well, but still in the men group, it's several times higher suicide rates that we are having here, and that indicates, of course, that we have to define problems and to start solving them. And of course, scientific researchers identify risk factors like men experience more psychosocial stress. It is demographic scientific researchers define that. Of course, psychosocial stress is higher. Unhealthy practices like alcohol and dependencies on drugs and etc. higher. More likely to work in dangerous psychically demanding work as well. More likely to die from external causes and etc. So the risk level is really high, and this slide really good shows the age groups of men mortality, of men suicide mortality. We can see that if we would look at the woman group, the highest suicide mortality is in the 30-39 years old age group. Of course, in the men, it's the same group, 30-39 years old, but still it's really high in younger groups, 20-29, and of course really high in older groups up to the pension age group, but still it's expressly big mortality in all groups except children and except 80+. So that defines that this psychosocial risk is actually in this middle age or below an average of middle age is really high. And of course we can, all of us, we can find and discuss on the reasons. Also scientific researchers can answer us those questions. So as I already mentioned, government's action plan, the first time in Lithuanian history we have in government's program the measure which aims to establish a model of cooperation and methodological support for strengthen non-governmental organizations providing complex assistance to men experiencing emotional and psychological crisis. So there we have a model of cooperation, there we have methodological support, and we have the strengthening of non-governmental organization sector. So we have three measures, three aspects which we think it should work in our country to change the situation. And I'm really happy that NGOs are already in the process. They are already close to those men who are suffering, and not only men. I mean, we have to work as well to boys, to children, and to set other understanding of mental health and emotional health and practices. I will not go through the Nordic project. I'm really thankful that we are having this project, that we are changing our practices, that we are meeting and discussing. That is the first steps to create the methodology and the model to implement our governmental program. And of course, in Lithuania, we are having already a few years grants for non-governmental organizations as a ministry for counseling services for men experiencing emotional and psychological crisis. And of course, there's a psychological, psychotherapeutic, educational, legal counseling for men, and we are funding those projects and trying to reach as much as possible target groups. So some numbers like emotional support for more than 3,000 people, psychological support, more than 1,000 people, and etc. So it's these numbers only for 2022. But still, we understand that we have to reach much wider target group, and these are only first data. And really, we are happy that we are having two men associations in Lithuania. It's like umbrella associations, bringing together men's organizations. Lithuanian Men's Association and National Association of Psychosocial Support for Men. So, of course, these associations are as well sharing practices, sharing advocacy, lobbying, and other competences that we really need in Lithuania and in European Union as well. So, shortly, thank you for your attention.
Thank you, Vice Minister. Thank you. And I would like to invite Christian to share something. It's slow. Just slow.
Labadiena, and good morning, everyone. And it's really lovely to be back here in Vilnius, where I spent 9 years of my life working at EIGE. And I would very much like to thank for the Lithuanian government, the Nordic Council of Ministers, and also EIGE to invite me here. I am Christian Veska. I'm the Equality Commissioner in Estonia, and I would like to go also through a few slides to show what is the situation in Estonia. So I hope that this would also bring new perspectives in. But of course, some of it, what I'm going to show, it already resonates what Alexandrina was saying earlier, and what you were also just mentioning now, because I think in the sort of Baltic region, there are differences, but these differences are not actually so pronounced. So we are quite similar to each other. But if we think about the sort of stereotypes that Alexandrina was talking earlier, then it's interesting, I think, in Estonia's case to see that in the sort of declarative level, men and women both agree that it's good to live in a society where men and women are equal. So people understand that in a way, and they already frame it this way. However, it gets, I think, more tricky when we start looking at the very specifics. Then this sort of declarative level somehow disappears. And we see that only 61% in Estonia agree that also men win from the gender equality. So there is a big sort of room there to make people understand that gender equality is actually for men's benefit as well. And out of this number, a quarter of men don't realize that themselves. They don't agree with that statement. But coming to stereotypes, so I wouldn't stop here too much because it basically resonates indeed what Alexandrina was saying, with one exception is that more men in Estonia think that parents should divide parental leave equally than women. So that means that there is sort of, from men's side as well, willingness to be more engaged in their family life, in their children's life. There needs to be some sort of a push, though, to make it happen. And again, like these same things, reflecting what we saw from the Eurobarometer, that still too many women and men think that ensuring families' financial stability is mainly a task for a man, and they're not entirely convinced that there should be, it would be good to have more women in managerial posts. So that's one thing on the sort of attitude side. But again, now, how do people, or men and women, live in Estonia? So we, similarly to Lithuania, we have a huge gap between women and men when it comes to the healthy life years. So men live 54.1 years healthily compared to 57.6. And we see that the main questions that we will be talking about here, such as emotional health. It's an interesting statistics from the health statistics that I found was that actually women reported more, but for men definitely one of the key questions is whether they are in a relationship or not. So the ones that are in a partnership report lower levels of depression compared to the ones that are not in a relationship. And similarly with the prevalence of emotional distress as well. I will jump over this intoxication and injuries part because it is very similar to Lithuania, where men basically drink more and harm themselves much more than women do. So we have the same regarding the alcohol consumption as well, of people who drink more than 3 times per week. I mean, you see these gaps are huge. Same with the smoking. But I would stop here for a moment because that I haven't heard is the sexual and reproductive health. I will come back to that a little bit later. But it's interesting to see that more men, for example, in order to prevent STDs, they use condoms in comparison to women. I mean, the differences are not that big, but and the overall levels are still shockingly low. But at least you can see their responsibility. And I would actually now mostly like to focus on what we here to speak about, what's in the national sort of plans. We have the National Health Plan 2020 to 2030, and one of the key objectives there is to also reduction of health inequalities. And the sort of objective that they have set in the National Health Plan is that by 2030, the difference between the life expectancy of men and women is not greater than 6 years. And the difference healthy life years is not more than 1 year. So it's sort of clearly set there. And I think what is a novel thing for Estonia that we didn't have or haven't had much in the past is that this health plan is also connected to other sort of key governmental strategies, like on the well-being and equality, or also the education one. Some specific examples as well. I will just mention one here. It is that's already since 2005 we have had the system of specialist men's clinics, which the andrologists working there have done an amazing job in terms of talking about men's health issues and putting this on the sort of wider public agenda as well. And it's not anymore just in the capital Tallinn and the second big city Tartu, but it is also like right now in Pärnu and Narva with the video consultations also possible. And what do they do? It's the life course approach to the sex-specific issues. So it's lots of focuses on the reproductive health and also diseases, but also one of their the doctors themselves say that it is actually the emotional and psychological support that quite often men need who are turning to them. So I will stop here. I'm really looking forward in actually discussing this further in the panel, and I just leave it here. Thank you.
Thank you, Christian. Thank you, Christian. And I want to invite Ieva to share your experience also in Latvia.
Yeah, hopefully. So good morning, everybody. It's really great to be here, and thank you for our Lithuanian colleagues for having us here. It's looking forward to a really interesting discussion. So I will try to really shortly talk about what we have done in Latvia regarding men's issues and policies. And I would like to start with the fact, I would like to stress it, that we don't have a systematic approach right now to men's issues. when it comes to gender equality framework, our approach to men's issues within gender equality has been more of on an ad hoc basis. So when we talk about men's issues, the main policy issues is work-life balance policies, fighting gender-based stereotypes, and reducing domestic and gender-based violence. So when it comes to promoting work-life balance, we talk about equal participation in childcare, equal share of care responsibilities, and being informed about your rights and balance for work and private life. And if we talk about specifically about men's issues here, we really have been focused on promoting fathers' role in the society and making campaigns that openly acknowledge challenges for men, being fathers, and especially being single parents or divorced fathers, and the challenges that comes with that. So we try to create open dialogue about these issues with men. So fighting gender-based stereotypes for us is a crucial process for gender equality and to also promote men's well-being. And fighting gender-based stereotypes is at the core of our plan on the promotion of equal rights and opportunities for men and women. And the three aims of the plan is equal rights and opportunities for women and men in the labor market and education, prevention of domestic violence and gender-based violence, and strengthening gender mainstreaming. And when it comes to gender-based stereotypes, we especially focus on labor market and education because career choices and higher education in Latvia tends to be very gender segregated. So this is a good example of a campaign from our colleagues at Society Integration Foundation about promoting atypical professions for men, breaking gender stereotypes, and also kind of promoting caring masculinities. And the campaign slogan is "She can, he can." So when we talk about stereotypes, we talk about stereotypes also regarding health and self-care. And yes, the situation is similar like in Lithuania. In Estonia, men do live on average fewer years than women. In Latvia, it's in Latvia, men lead 9 years shorter lives than women. 64% of men in Latvia have never used an opportunity to get a free preventive health checkup, and men in Latvia are 3 times more likely than women to die from external causes, meaning, for example, car accidents, work-related accidents, also suicides. 84% of suicide cases in Latvia are men. So what we have been doing, the November usually is Men's Health Month in Latvia. We usually raise special awareness about prostate cancer because it is one of the leading cancers that kill men in the age group of 40 to 60, and men usually don't seek treatment. They seek treatment when it's already, unfortunately, too late. And we also have had discussions about fighting stigma about mental health and asking for help. So regarding gender-based violence and domestic violence, it is really important for us to include men in this conversation, also as victims, even though statistics show in Latvia mostly women who are suffering from domestic and intimate partner violence. So one of the things we have in Latvia since 2015, we have a state-funded rehabilitation program for perpetrators of violence. It's not a gender-specific service, but like the idea is to help adults who have committed violence to understand the consequences of the use of physical and psychological violence and to reduce violent behavior. And the service is provided in the form of individual or group therapy sessions as close as possible to the person's place of residence. It is also important to work with young people, so together with NGOs we have organized workshops for young people on how to build respectful relationships based on gender equality, free from violence, and also teaching about harmful gender-based stereotypes and conflict resolution skills. And if we think about campaigns, every November we have a big social campaign against domestic and gender-based violence. And lately, like last years, we have been thinking about also including men's perspectives as being victims. So last year we had a campaign about emotional violence, and the slogan is emotional violence invisible but real. And we also had men come and tell their stories of being in emotionally abusive relationships and how to ask help and how to recognize that you are in an emotionally abusive relationship. And as you can see, basically, like, the idea is you have scars, but then you cover them up, and the man has written manipulation on his torso, and the lady has threats here on her neck. Yeah, that would be it. Thank you.
Thank you, Eva. And I will talk about all these campaigns and discussions, very interesting. And I want to invite also Alexander Anderson from Kvinfo, Denmark. 5 minutes. Yes. Just the computer slow, sorry. It takes time to prepare a good presentation.
5.5 minutes.
Yes, fortunately for you.
Thank you. And thank you very much for the invitation. My name is Alexander. I'm a senior political advisor at Kvinfo, and Kvinfo is a knowledge center for gender equality in Denmark. And I'm also a former chairman at Danish Men's Society, which is an NGO of men working for gender equality. And what I would like to do is try and outline a change going on in Denmark these years on gender equality and in particular men's gender equality issues. And my claims are that the services addressing men's issues are on the rise these years at the local level, and they are also finally emerging as a part of national gender equality policies. I think this should be seen as a part of a rise in gender equality policy overall, which is fueled by the Me Too movement. So I'm suggesting here that we are seeing a regime change, and the pre-Me Too column on the left side is trying to summarize the political science research on gender equality policy in Denmark pre-2018. And the previous decades were characterized by gender equality being low on the political agenda when you compare to the other Scandinavian countries, a low number of political reforms, and only 1 in 6 identified as feminist, and that's 1 in 6 out of the population, even fewer of the men, obviously. And these decades were focused on primarily what you could say the gender equality classic issues, the issues defined by the women's movements, and men's issues were not really a part of that. And they were only promoted by non-feminist organizations or even anti-feminist organizations who saw feminism as the reason for not including and involving men. And what we're seeing now, especially after 2020, where the Me Too movement really had a big impact in Denmark, is that gender equality is much higher on the political agenda. More people identify as feminists, and the gender equality agenda is generally expanding to look into new issues, and I would say that men's issues are one of those. And one of the new things is that you see feminist men's organizations, including Danish Men's Society that I co-founded a few years ago, Dare Gender, another organization that some of you may have heard of, and they address men's issues as a part of a feminist perspective, looking into gender stereotypes and gender stereotypical expectations to men as being very masculine, not needing help, that sort of thing, as we've touched upon previously. And we're also now seeing at the national policy level that these issues are emerging. And just to outline a few key milestones in recent years at the national level is the big thing has been the new parental leave scheme that came into force a year ago, earmarking 11 weeks of leave to fathers, and that has really made a big difference in the debate in talking about men as rights holders in a gender equality issue and talking about men in parenting. And it's also changing the collective agreements on the labor market. It has done so this spring, so that more men will have paid leave as a part of their contract. One thing that's not mentioned very often as a men's rights issue is the new consent-based rape legislation, but I think it's a very important thing to mention, because when you have, as we previously had, a definition of rape that defined rape as something that had to do with physical force, it tends to stigmatize male victims because they are usually physically superior to the woman, and that makes it very difficult for people to understand that rape can actually happen even though you are a man. And this new consent-based thinking is actually fundamentally changing the thinking about male victims of rape. And when the legislation came into force, the first year after, we had 5 times as many reports from men the next year. We also had a big rise from women victims, but not as much. And another thing is intimate partner violence. The intimate partner violence in Denmark has been, and the services have been fueled by the women's movement, and they have done an amazing job over decades. But it's only recently that we have started to see that men are also victims of intimate partner violence. And just, I think maybe a month ago, the government said that they would actually change the legislation to provide equal rights for men to shelters and to psychological counseling when they're victims of intimate partner violence. And when we look at the local level, I've brought this map because another NGO that working on men's issues in Denmark, Forum for Men's Health, are monitoring all of the municipalities in Denmark and their men's focused services and ranking the municipalities. So that's what this map is showing, is the darker the color, the more services, and the gold one is kind of the gold standard. So that's the best ones. And these services cover a lot of different services concerning health, well-being, rehabilitation after cancer, heart disease. But if I was to give like one conclusion, it's that this new earmarked leave for fathers is changing this very fundamentally, because so many municipalities are making new services, not only support groups for fathers, but also screening and services for postnatal depression, which has been something that we have tended to overlook when it came to fathers. And that's changing. A lot of municipalities are now screening. Not enough have services to provide to the fathers, but it's going in the right direction. So to look forward, what's going on right now at the national level is that the Minister for Gender Equality in the middle is consulting civil society organizations, including Kvinfo and a lot of men's organizations. They're developing a national action plan that Kvinfo and other organizations are providing a lot of suggestions into, and we're really looking forward to that. And also, just to mention one more thing, is that there's a lot of political focus on the gender gap in education, boys lacking behind, and I think in Kvinfo we really see that as a great platform to try and address gender stereotypes when it comes to boys and men, and try to make long-term prevention on some of these issues that we see in men's lives. Thank you.
Thank you, Alexander. And now I would like to invite to share your experience Bo Helsing, Young Men Clinic from Sweden. Eurovision winners.
So I'm also nervous, wondering how I ended up in this fancy panel, actually. Yes, I'm not on the organizational level, on the national level, but because I'm representing a public health clinic in Gothenburg, mostly, and western part of Gothenburg, western part of Sweden. And first, thank you for being invited to the conference. In Sweden, this is called Mottagningen för unga män, and it's shortened MUM. So about 20 years ago, young men that come to visit us thought that we had very boring paper where he wrote down the timetable when he will come next time. So he designed this to us. And imagine, you know, Gothenburg is a coastal town, a lot of sailors, and this is where sailors used to have on the shoulder back in the days on the ocean. So, and I'm also here because a few years back I was involved in Swedish Association of Local Authorities and Regions project about masculinity. I put some reports on the table out there, and also I think it's one X on my dissertation actually out there as well, if someone wants to have that. So, Young Men's Health Clinic, you know, in the context in Sweden, there are over 200 youth centers in Sweden. And 90% of the visitors are females. And For 25 years ago, some man went to Gothenburg City and told them that this service was not targeting young men, because it was midwives working there, and the whole place was kind of focusing on young women, and they were left out in a way. So then Mom started to focus on men's issues, and focusing just on masculinity and emotional health and sexual health. And you know, according to research, men have difficulty to talk about emotional health, and they have difficulties to talk about sexual health. So why don't we address that? Because if we have doing that and have a male-friendly environment for doing this, they will come. I guarantee that. And in recent years, we have, through lobby work, multiplied. So now, from this spring, we are 6 these kind of clinics in the western region of Sweden. MUM in Gothenburg is open 2 days a week, and the others 1 day a week. And in 2022, there were about 2,766 registered visitors. In Gothenburg, 2 days a week, we had 2,000 visitors. So if you address this sexual health, emotional health, relational health, the young men will come. And then I just want to point out that we know a lot about masculinity norms, and the panel has really nice show that is really important stuff. And this is just some quotes from young men that I have been interviewing over the years. And this will not be going through right now, but these quotes are from men who actually sought help. So although they are going to seek help, they are still within them these barriers of masculinity norms. Yes. So at MUM, we focus on how to increase our approachability and our receptivity to young men, because we think that one thing is we need to do is to understand that masculinity norms doesn't just exist in males. They are existing in public health services, and we need to educate people to be more male-friendly, to be more open, and know to get the young man the time and space to develop sayings for themselves to explain how they feel, what their concerns are, what the worries are. Sometimes we acknowledge our clinic as a worry clinic, because the young man comes with a lot of worries, different kind of worries. And if they don't have anywhere to go, they will be isolated, they will not talk about it, and if they have a place to go, they will come. So I was glad to hear that Estonia had clinics like this as well. And the final is, not the final, this is a quotation I use from and borrow from the French philosopher Jacques Derrida that I think is important to always have in mind. Because in Sweden there are a lot of talks about young men, but there are not so much talk with young men. So we need to change that. And he says, but between talking to young men and speaking of young men, there is a word of difference. From the moment they are spoken of instead of being spoken to, it is to say that they are no longer or not yet there. It is to register their absence. One speaks of young men only in their absence, concerning their absence. So we just need to more focus on spoken with young men. And all the young men that visit us in the clinics in western of Sweden, we call them ambassadors, because they are going out and they will recommend other men to come to the clinic. So in Sweden we call it rings on water. And this particular young man said that I had done everything that I as an individual to myself can do, typical man. I needed someone who was better than me in at this kind of thing, and then my friend talked about mum. And I actually interviewed the other guy in this, and they sat in the gym, talked about important issues, and he recommended, and he said, psychotherapy is damn good to his friend. So I think you need to be patient. We started in 1999. And it took a couple of years, and then we were up in 2,000 a year. So you need to start clinics to invite men, and they will come, and it will grow. So thank you.
Thank you. Thank you, Bo. So I think that we are sitting for 1.5 hours already. Yes, I think that a little bit energy is down. I would like to invite you to stand up, just to to do some exercise. Now 20 sit-ups, 15 push-ups. No, I'm joking. We can do like this a little bit, just not to be careful with your neighbor. Just do like this. We can do a little bit jumping, increase lymph going up, and increase energy. All the waist going down, so it's easy, because we need still energy for 1 hour till the lunch break. So just, we can, how to say, wave like this. Yeah. You make sun. Sun is shining. Yeah, it's nice. Okay. Now we feel joyful and energized. We can continue to our discussion. Thank you for participation. So thank you everyone for your presentations. It's for me it was very interesting to hear all the initiatives, and I wrote a lot of things. But I would like to start from one question for everyone, just to make a discussion more interesting. And first, the question will be very, very, very easy. What would need government to do to help more men? Just easy question. What do you think? Not what your government thinks, but what do you think the government needs to do that for men that it will be easier for them? And we have microphones, so feel free to answer. I will ask everyone, so it's mandatory. Thank you, Christian.
So I can start. Is it working?
Yep.
Yep. I think one of the things is that that it's not just about men, but it's generally you need to have like targeted approaches to certain things in the different strategies, and they need to speak with each other. Like you have the sort of health strategy, you have some education one or whatever. So, but it's basically the concept that we've been talking in the gender equality field so long. It's gender mainstreaming. That's what it's needed. That it's whatever you do, there is no sort of general mass of people. No, these people are women, men. They belong to certain different groups, and you need to address that these issues, their issues, to get to them. So only then, when this foundation is laid, you can actually start designing appropriate measures. Before that, we're talking about just some faceless mask, I think.
Okay, thank you.
Well, I agree that that was my answer also. Gender mainstreaming, definitely. Just wanted to add that definitely awareness raising among government and local government officials who work with policy kind of raise awareness about gender mainstreaming. It's really technical and hard job, and it asks a lot of resources, but it is worth to invest. And basically awareness raising, how to gender mainstream, also the importance of gender disaggregated data, so you know where are the problems for each gender, because a lot of issues are gendered in our society, whether we like it or not. So yes, that would be the way to go.
I think that the panel's presentation and the former presentations have shown that we know so much. So let's start doing the job, I think.
What should they do? What should they do, from your opinion?
Yeah, there are a lot of good examples, but the good examples need support. The good examples needs to be rolled out in a bigger way, and I think if you do that, you will find a lot of vinster, a lot of success in other areas as well. You know, violence, depressions. So if you, sometimes I think about when you have a disability, you maybe need a ramp to get inside a building. Males also need some kind of ramp to get in. So you need to design that ramp in a way that man goes in.
It sounds very nicely. But I would not. I don't want to let you go with this question. The ramp, yes, it's a nice metaphor. In your country, or maybe only in Göttermer, what do you think the ramp is, or could be like more nicer maybe ramp?
I think our speciality in focusing on both sexual health and emotional health and relational health is a key point, actually, because then you get a variety of men. It concerns every man that have sexual health. So you get a variation of different kind of men, and you always need to be. You can. They need to test places. So I think our clinic is a golden project, actually. It's working quite well. We have always waiting lists. There are more men that come to want to see us than we can meet. So it's working.
And you said that you in the Gothenburg you have only 2 days per week open. What would need to happen that it would be 3 days or 4 days or even like 5 days per week?
I think that actually we need to be more and more this kind of clinics, because now it's just in the western part of Sweden, so we need to be more. And then I also think that we should educate other public health services and other services to be more gender sensitive in this way. So in the future we will not be needed. In the future there will be public health centers for people. But now we need this. But in the future, hopefully, we will be needed.
So as I understood that one is like local center, like physical center where to come with broad problem bag, and then also to educate and collaborate with other public health services just to inform them about some gender differences about and gender problems in different fields. Okay, thank you. It's nice working with.
Just a few words. I'm silent, and I would like to gather all the ideas what government should do, because that is the tasks for me, and I hope my colleagues are writing down and will be writing down all today and during all the project. But in general, I agree a lot that it is part of mainstreaming, but gender mainstreaming has a long history. And we're talking about men emotional questions from 2018, 2017, and in the political level, of course, there are discussions, but to make an impact on the ground, especially in Lithuania and, for example, in regions or in small towns, it is a work on the society behavior, the perception of the question, the perception of gender roles. And of course, the capital has the one behavior, and the rural areas have another perceptions. And I think the most important thing is really good communication, and those communicational companions can do even better impact than the change of legislation. And it can change the behavior and the even level of violence and a lot of things. We in Lithuania, we all know the campaign of safe driving in the roads, which actually connects a lot with this man emotional questions. And a lot of quite good videos on TV, how we have to drive safely. And during 10 years, this campaign had a huge impact on the mortality on the road. So the communication is really important, and mainstreaming into the health and educational sectors from the first grade gender educational questions should be integrated as well. But still, we have the reactions from the communities, from parents, which maybe do not want their children to be educated in those topics which are quite strange for them. And there we have the difference of perceptions of older generations and younger generations. So I'm saying that it will take time. And of course we have to act sustainably, not to stop anywhere, understanding that that doesn't work. No, it will work, but we need just more time and of course more funding from the government.
And how do you think, how many years we will need to have good enough gender equality and men's health in Lithuania?
Well, in Lithuania we have middle-term strategies up to 2030. And then we have long-term strategy up to 2050. So I think 2030 is the first step which we have to have a milestone to reach certain indicators like mortality and violence and life expectancy and different indicators, which is the first step, and we have to just set our action plan reaching for those indicators. And 2050 is long-term strategy, like a vision where we are going as a country as well, in geopolitical context, understanding that our neighbors as well have the perceptions and we still have interactions in different contexts. So,
thank you.
Yeah, I'll try and answer too. I was a bit reluctant to go first because I think it's difficult to choose which suggestion to bring forward. We actually in Kvinfo we developed this whole catalog of suggestions for our government how to address men's issues. And if I was to say like an overall thing, I think it's just very important to thoroughly integrate men's issues and men's perspective into gender equality work, and to actually try and have a strategy for long-term changing of gender stereotypes. And I think we've had a lot of good policies in Denmark that are changing stereotypes. For example, the parental leave scheme that I was talking about, and policies regarding violence and rape, etc. But it's never really been a strategy to change gender stereotypes. And I think the business case is just very strong. Obviously, you could do all these things to make men feel better and be more healthy. But you have other arguments too. There are lots of good reasons that the government should do this. One is that I think it's a good investment. Like we will get better educational outcomes if we tackle gender stereotypes in education. We'll get less violence if we tackle gender stereotypes and toxic masculinity. And also, these years, it's very, it shows that the lack of focus on men in mainstream gender equality is being weaponized. It's being used to mobilize misogyny and anti-feminism in Denmark and globally. And I think we can't address that without addressing the root causes, which are the legitimate concerns of men. Not to say that the misogyny is in any way legitimate, but some of the concerns that are unaddressed are actually legitimate, and we need to address that to counter that movement.
I will ask you one more question. It's more about governmental help for the men's organization, those NGOs which work with the. Do they have some support, and is that support is enough? Or I understand that it's never enough, but no, it's still a question. But still, do they support?
The government support for men's organizations in Denmark is very limited. So at the moment, we have one civil society organization that is working specifically with men's issues that receive regular state funding, and they receive less than €1 million a year. And it's temporary, so we don't know after this year. And that's the organization I mentioned, Forum for Men's Health, and they're doing a very important job. Other men's organizations do not receive any state funding. And I'm not counting Kvinfo, because we have a much broader mandate on gender equality as such.
So it's not only about the men, but it's more about all the gender equality.
Yes. So we have other gender equality organizations that receive a lot of regular state funding that have men's issues as a part of their focus. Yes.
Oh, okay. Thank you. And Bo, you also, it's not governmental NGOs. So it's how you attract support, or how you do it. Is it only voluntarily? How is it working, your clinic?
We are a part of the public health.
So you're part. Okay. How you get that?
We strived. we started in 1999, and in the beginning we had these foundings from, HIV and foundings, and in 2012 we actually get a permanent founding from the local authorities in Gothenburg and the health service in the region. So now we're just a part of the public health system.
Okay, nice. You have good support then, or is it not enough?
It's never enough.
Okay. It's never. We hear that men's health are influenced by a lot of factors. And when we are talking about men's health, so it's a physical health, it's emotional health, it's a sexual health, it's a psychosocial health because of the relationship. Also, it could be attached to the emotional health. And all the countries want to tackle all those things. But maybe it's a very naive question, but what do you think if one or two elements could be tackled, maybe it would be like a dominoes, like if we tackle one thing and we put all the, I don't know, not all, but majority of the investment to one issue or two issues, and it fall down like a domino, and then men's health increased, and we would see less mortality rates, less suicide rates, and more emotional intelligence during the men's issues. So maybe.
Yeah, I think we are seeing a sort of a domino effect with with the change in parenting norms that are happening these years, partially due to the new parental leave scheme, because we see that a more equal sharing of parental leave will lead to a more equal sharing of responsibility in the home, not only regarding childcare, but regarding unpaid domestic work. It will lead to a more equal sharing of the important relationships that we see that men are missing out on in their lives, and which cause them to be lonely. We see in Denmark that we have when we have divorces that the shared custody is usually shared so that men get less time with their children, and it's not because they are discriminated against, it's because they didn't take as much part in the parenting in the early years, and then it just hits these fathers as out of nowhere. They were not aware that this was going to cause them to see their children less after a divorce, but that's what happens. And you also have the norms of who in the heterosexual relationship, who takes care of the social relations of the family. It's usually the mother. So men more often than women end up lonely without close friends that they can talk to about important issues to them when they divorce. So I think when we change those parenting norms, we'll in the long term we'll have better parenting, but we'll also have more healthy men.
Okay, thank you. It's a very interesting idea, and prolonging the parental leave could help to decrease men's loneliness. And I think that loneliness, we don't talk a lot about that, but I think that loneliness is one of the reasons why there is so many alcoholism, also suicide, also violence too, because you are lonely and you don't, maybe violence is less, but still if you're lonely and you don't know what to do, go to drink and then go to beat someone. So it's some kind of way. So it's an interesting idea how to tackle loneliness from the more from attachment style, like to teach men to be more attached to the children, and then they are more in relation to their sharing more. So that's a very interesting idea. Thank you.
Yes, I would come back to this domino effect, and of course in a sort of nice society or nice environment that kind of steadily goes towards it could happen. But there are, of course, the external sort of factors that one needs to take into account as well. And therefore, the situation can actually change quite quickly and not the way that we would like or expect. And of course, here I'm referring to sort of the situation that we are in now. So in our having our neighbor country, neighboring countries being militarized, and that actually has a strong effect, I feel, to the how men are feeling in Estonia as well. Because at the end of the day, you still, as a man, you feel that okay, if things go bad, you're the one that has to do something, or go and I don't know, go to the war or be killed and so on. So you can sense that sort of sentiment coming through as well, that there is anxiety around it, and that is not a sort of a good situation to be in. So we don't know, of course, right now the sort of long-term effects of where we are in Europe right now, but I hope that the focus will indeed remain in kind of solving the issues that you have internally as well, and really progressing in the ways like be it through the parental leave schemes and things like this that kind of changes the situation of men locally, in a way, so that thereby also reducing this sort of anxiety as well that you may get otherwise from the global issues that we're facing.
So you are saying that we should tackle more emotional needs of men and then help them to somehow express emotions, express those emotional needs, and also share some kind of problems and issues with others that they would also hear, and that the men don't feel alone in that, because of course if there's like some kind of military situation, so yeah, more or less men think that they would go to the war.
Well, I don't think actually you can separate all these different issues. They are so much interconnected, so it doesn't really make sense to separate. But definitely this sort of emotional health issues is one of the key ones. But again, I mean, these issues come from somewhere, so maybe you'll need to address something else first. So it's a complex of things, so I don't think it's possible to separate.
Maybe it's dependent on the country, like on the neighbors, and then where is like more safe countries, more in the West, more safer countries, more in the East, not so safer, and we have also mentality about a little bit different. We got this Soviet Union, and the Soviet Union left some things to us, and our thinking, and our parents' thinking, our grandparents' thinking, and we consider to taking it through.
I mean, definitely there is a historical baggage, but actually I'm not so sure that that it's kind of wise to make this separation that you have the Scandinavian countries and men are one way, and you have the Baltic region and men are the other way. I would say that the things that may be more pronounced in Baltic states, but the same issues are still applicable in Scandinavia as well.
Okay, thank you. Thank you for clarification.
Yeah, I agree with what you're just saying, and I think it's really necessary to have the knowledge to tackle issues by your emotions, because if you go home and in the end of the day and you sit alone with all those emotions, you can be in a dangerous place. So you need the emotional competence. And I used to talk with the young men that I meet in therapy about emotional democracy, that every emotion has its own right to be heard when it's needed, and in a respectful way and a respectful expression. But you need to acknowledge the emotions that you have, because the emotions help you through the day. Think of it, an ordinary day, you will get reluctancy, you'll get difficulties all through the day in different kind of levels, and you need to some way tackle them, and you do that by your emotions. And if you don't have a democracy, you will end up not taking care of yourself and others around you.
Yeah, it's a quite usual issue for men. Yeah, still it is. So I think that we need more advocacy for men going to therapy groups, or just men groups, just be with someone in the safe environment where they can share and have democracy of emotions, because not in every environment you can share all the emotions, because everyone is vulnerable, and you know it's difficult sometimes to share your most vulnerable emotions with others, even if they are men, especially if they are men. It's difficult to show your vulnerable side sometimes. So yeah, more advocacy for emotional health.
And a few words on this domino effect. So of course we have prevention and postvention, if we divide. So of course prevention is family or parenting styles, education system, health system, and etc. That could work as a prevention. But already we have a lot of people who are after or in the situation of alcohol consumption, of dependency, of different alcohol, drugs, and abusing, and they are already after the domestic violence already did, and maybe they already been in this aggressive state. And we usually stigmatize those people, that they already did something, or they are already not a part of society, and we are excluding them. The families are excluding, the community are excluding, and seeing those people as already with a stigma, especially families after domestic violence and etc. But understanding that this is direction to the trauma, and where's the trauma? And understanding that the domestic violence sometimes is the dance of two partners, and the violence is only the outcome, what happened. And in our domestic violence, how to say, we have a new law which will start in this year, working with aggressor, eliminating the aggressor for 72 hours after the case of the violence in the family. We already understand that after this case, we have to work with the family, not only with only one aggressor. We have to work with the two partners. If there are older children, we have to work with children. We have to work with all the small community to solve the case, because usually it is not one person's problem. It's the dance of some actors in this context.
That was strong. It's I think that's a very deep issue with all this reintegration of men, because if you one-time abuser, you whole-time abuser, like that's a stigma, and there is not enough help to go from that abuser to be already like a normal man, and there's, I think, not enough modern psychotherapy help for men tackling these issues and helping. I think that it's like a promise, I think, yes, from the ministry to help with that. Okay, I will. You hear that? Sorry for this provocation. Yeah, I have a question for you specifically, because you were participating in men's organization in Finland and Sweden. Yeah, so maybe you like imported some ideas from them to your country, how to affect the political agenda and how to influence that.
Well, influencing political agenda, that's a very complex and long work, but we try. But what our, I think, main takeaway was thinking about the services for men who have been perpetrators of violence or who have suffered from violence in their relationships, and how to make, what can we do to make services more low threshold for men. So you don't have to necessarily go through, like, for example, social services. There's a big stigma to go to your local service and say, hey, I have a problem. So yeah, this is definitely one perspective that we are thinking right now, how to make services for men more available, because women are more likely to go and ask for help. For men, it's a big stigma either way. If you're a perpetrator, there's a stigma, and if you're a man who has suffered violence, it's also big stigma, and they don't call police, they don't want to go to social services, etc. So yeah, this was one of the main issues.
Yeah, and we saw your campaign about this emotional violence, and how public reacted to that campaign? What was the reaction?
Well, we did it together with the NGO who has a helpline, and on the posters there's this number you can call and talk about this. And when we asked after the campaign if the calls spiked, yes, there was a spike in the calls from men, and there were some also angry calls from men that men, well, finally you did something. Men are always portrayed as perpetrators. We are suffering too. But yes, there was an impact. in the campaign, and I think it's important to find different ways in the campaigns about domestic violence, how to communicate with men. We can't do the same thing over and over again. For example, like the man is always like this big husband who beats his wife, and like she's all bruised, and these horrible pictures. Maybe we should talk with men about the violence as, for example, witnesses. Hey, if you're witnessing, if in a bar you're with your friends and you see a girl being harassed, you should step in. And so in these kind of different subtle ways, talk with men about violence, not only as perpetrators.
Yeah, and I think that, so they spiked after the campaign, and how, I think that that's as usual after campaign they go down.
Yeah,
yes.
Unfortunately, it's you have to like talk and talk and talk. Unfortunately, resources for campaigns are not infinite. But yes, definitely we need to talk about this issue more publicly with men, and men also coming and sharing their stories. It's really important, like other men hearing.
Yeah. And the campaign about gender equality, when was the man doing manicure?
Yeah.
I thought that was very brave.
I guess, yes, but why
that
not?
was accepted well in the public?
Yeah, I personally, I didn't hear any comments. I'm sure maybe in social media, but I should then ask my colleagues from Society Integration Fund. They did a 6-year campaign on different bases of discrimination, and this was, I think, 2020 was the year about the gender equality. They did campaigns on disability, sexual minorities, and etc.
Thank you. Maybe there is a question from the audience. I don't forget you. Yes, I will come to you. I see. First there.
Hello, my name is Margarita. I am working at Center for Equality Advancement. It's basically like women's rights organization, and my question will be addressed to Alexander. And I would like to ask you, because you already heard that Lithuania is making baby steps, so when you start to make baby steps, it would be good to go to right direction, you know. So my question would be, from your experience, what should be done to ensure that all initiatives which are related to men's health, doesn't matter which kind of health, would go hand in hand with gender equality values, or because you know, we can have emotionally sensitive and very healthy men, but who will be not actually supporting gender equality. And if you are counting like increase in percentage of men who are calling them feminist, I'm afraid in Lithuania probably it would be enough one hand or two hands, not percent, but hands, to count one by one how many we have men who will be courageous enough to say that they are supporting, they supporting feminist ideas, and that they are feminists. It's like absolutely exotic in Lithuania. So what should be done from the very beginning to ensure that we are in the right direction?
That's a very good question. Thank you. I think I have two suggestions. First of all, when doing the advocacy work, I think a part of this is if we need to tackle the men who don't want to identify as feminists or see men's rights and feminism as opposing. I think it's helpful to insist of framing your solution on the men's issue as a feminist solution. So that's when I was chairing Danish Men's Society, I would try and come up with the best solutions for these men's issues, and then afterwards try and say why is this a part of the feminist project? And then obviously some people would say I buy into the solution, I don't buy into the ideology, that's fine, but you try and normalize the connection. And I think I think it's just coming back to solutions, that we actually need feminists being vocal about solutions on these issues. We cannot only talk about, well, we talk about masculinity too. No, we need to talk about what is actually needed to tackle the concerns of these men. And the other thing is, I think, how to make sure that your men's services are not just seen as a different thing that's only about men, but seen as a general gender awareness. And I think it's about training, gender-sensitive training of the front personnel. And when we talk about education, for example, in Kvinfo, we don't talk about making teachers aware of boys, only about the issues of boys. We talk about making gender-sensitive education, making gender mainstreaming into curricula, into the education of teachers, and showing how that gender sensitivity will actually address the gender stereotypes that are hurtful to boys and the gender stereotypes that are hurtful to girls. So we are not only talking about boys lacking behind, we're also talking about how to get girls into STEM education, for example, and showing how is that a part of the same project. And that's, yeah, so I think that's some important steps. I'm not saying that we are succeeding yet, but I'm hopeful.
Yeah. Thank you, Alexander.
Yes, thank you very much for a really inspiring conversation so far. And my name is Marianne Bergen Marianovic from the Nordic Council of Ministers. I was wondering a little bit about what you were saying, Bo, when you were talking about the stereotypes that are existing in the healthcare system, because I found that quite interesting, and I was curious about your reflections, or the panel's reflections, on how to work with these stereotypes that are connected with the professions who will provide healthcare services, and whether you think it has, if there are any potential solutions in educating or providing extra teaching, extra learning for these professions, or whether it has something to do with the dominant recruitment, at least in the Nordic countries. I'm not sure about the Baltic countries, but whether if the case that it's a lot of women working traditionally in the healthcare services, and whether this affects also the this ramp or the accessibility or availability of these services, and the appearance of stereotypes in the system. Thank you.
We know from research that males are shorter time in the healthcare situation when visiting doctors and nurses, and they are shorter time. And I think there is a pattern that women usually try to help men out when they are trying to explain their issues and the problems. And they have been socialized in that way for under the upgrowing, so they are used to that other people, usually women, take the place and explains things, and they are really untrained to focus on their emotions, focus on their needs. So that is why I think that we need to slow down the pace when you're seeing a man, and focus on that he will in some way put an answer to it. I recorded some of my colleague nurses. You know, some young men are really worried about testicular cancer, and they don't know how to investigate that. So I recorded this situation, and he was stammering, and he was trying to say something, and my colleague just waited and waited and waited. And finally he get it out, what he was worried about. But she didn't do anything, because she got the time to wait for him. And there is a project now going on, and there is this kind of doll that you can learn how to investigate men's genitals, but you don't, that we will try to doing for other public health services, but you don't just do the examine. You need the other competence as well, to wait and to be male friendly and to actually be receptive, because the young man who comes, they are really untrained to put the needs into words. It's one kind of answer.
And maybe from my side as well, to reflect a little bit. As I mentioned, in Estonia also we have the men's clinics. They are part of the public health system. These are absolutely, they have proved to be very necessary to have that sort of special clinics. One reason that I would think immediately is that I think your average guy is wouldn't be speaking about their sort of issues or questions that they might have with their reproductive organs to a general practitioner. So what happens, even though you should be sort of going through the general practitioners and they would refer you to the men's clinic, I think quite often the men take the route that they go directly to the clinic without the referrals. So it is important to have that sort of space that men feel that they can speak straightforward, and there is less embarrassment around these issues. But specific trainings, if you think around the sort of medical system overall, I think the specific trainings are of course important. And again, I can't thank enough these men clinics and the doctors that are working there for the work that they have done for the general sort of public awareness and the medical associations awareness. Because they are the sort of expertise holders there, and also they keep talking about the need to have the sort of understanding of men's specific health issues and when and what to look at. And then of course specific trainings, again they need it. Right now we are in the sort of process. There is a specific trainings for medical personnel to train about the LGBT community specific issues. So again, within this sort of context where we are, there was a big first research in order to understand how well do the medical professionals understand the specific needs of LGBT community, and how, like, if they know these things or don't know at all. And based on that, they started to do one think tank started to do the trainings for the medical personnel. So in a way, yes, you very much need this targeted approach if you really need to address or want to address the specific questions of this group.
Thank you.
Hello, my name is Georgie. I'm from the European Institute for Gender Equality. First of all, I really want to... Sorry, you're all having to turn around, sorry. I first of all want to commend Bo's really beautiful phrasing, emotional democracy. I think this is a really beautiful way to capture and offer this permission for everybody to experience emotion, the spectrum of emotion as well. But my question is actually for Christian. You just raised it a little bit now, maybe you could expand on it. In the context of men's clinics, you mentioned that there are life course approaches to sex-specific issues. Could you unpack what that means and what that looks like? What is that trajectory and its proven effectiveness? Thanks.
Yeah, thank you. So I can give you myself as an example. I was, I think, 16 the first time I went to the so-called men's doctor. We didn't have, at that time, we didn't have the specific clinic, but there were already andrologists working. So first you go there, of course, you ensure if everything is right with you and so on and so forth. So there are specific things that the doctors at each stage of your life will be looking at. So if you're 16, it may be, I don't know, issues related to your foreskin yes, testicular cancers. This is indeed one of the questions that I think young men often have. But it's also about building the habit of going to the andrologists. And once you hit your 40s, then of course it's recommended that you go every year. To check the situation of your prostate and well, any other questions you may have. So you probably know the statistics on the men's sort of disease much better than me. But if I remember correctly, then I mean over half of men over the lifetime will experience the issues of prostate, if I remember correctly. Not sure the percentages, but the older you go, the more problematic.
Please don't scare men.
I don't know if you want to comment.
Sometimes one can say it's the same percentage as the year. So if you are 75, there is a 75% of prostate, roughly. But I just want to comment on the issues about foreskin phimosis, and we are going to do this study this autumn actually about that, because we meet young men in the maybe 25 years old that never had sex because of the narrowed foreskin, and they even have nice sex with themselves because of that. So they have intercourse and start bleeding. And this will be really traumatic experience, of course, for both partners involved in this situation. So, because in Sweden they don't do this regular exam when boys are in teenager years, and if you ask a teenager, do you have problems with your genitals or foreskin, they will say, no, I'm fine, but they don't find often. And they will have big problems with that. So this is really something we will look into this autumn, actually, and make a study of how this have infected their psychosexual development through teenage years.
Just maybe one last thing around it as well, because that reminds me of in Finland there is for years there have been a very interesting project called Intact, which, speaking about the foreskin issues, that quite often what the medical professionals have done in this case is very easily is like, let's cut it off. And this is the practice, well, globally in many places that foreskin is removed. But it also comes with, or can come with serious health consequences for men, and also, of course, sexual sort of consequences. So this project in Finland, led by, I can't remember exactly the name of the sexual health organization, is actually advocating against that very much, and promoting the sort of ways how to avoid that.
Thank you, thank you. And we are almost at the end. I just would like to ask you just to share for one sentence, just before the lunch, because people get hungry if they late for the lunch. So just for one sentence, what would you like to wish for men's organizations, governments to help and increase men's health? Just for one sentence, just please think, formulate. And who will start?
Thank you.
I'll try. Yeah, I would want the government to address gender stereotypes in the long term for men and women.
Thank you. Thank you, Alexander.
I would advocate for cooperation, and understanding that men's issues are not separated from any other sort of issues in that way, that there are different groups of men, LGBT, disability, all of these. I think if you work with the men's issues, you have to be successful to take these different groups also into account.
Thank you.
Yes, and following the idea that I would like to invite the NGOs and the civil society to participate in decision-making process more actively, not only in gender mainstreaming decision-making process, but in disability decision-making process, in construction of the law, of the policy in Lithuania, in education system and policy formation process. That means that we have to be maybe more civil society, more understanding what decisions are made and why, and how can I, as a citizen, impact the decision. And we in Lithuania have all the measures to understand our future decisions and to say our word in internet, certain internet websites where all the laws, projects are already put. So I would like to invite to participate more NGOs and each of us to participate in decision-making process.
Thank you, Sina.
One sentence.
Just one, just one.
Just one. I think that men should be more active in the social reproduction that is pointed out by thinkers like Nancy Fraser, Bhattacharya, and so on, to be involved in the social reproduction of. So,
thank you, Bo.
I guess I would say more intense dialogue with NGOs, definitely, and working together for gender equality as a really important issue for both men and women, so we don't separate it.
So, for your wish, we will have time for networking for the government and NGOs, and now we will have lunch break. We will come back 1:15 here, online, and in the venue. Thank you all, and see you soon.
Hello, welcome back. Welcome back, everyone from the lunch. Yes, I see everyone. Okay, everyone, and welcome back those who are online. We're trying to continue on schedule. People now are satisfied with food, so they are not hungry already. And they are ready for next presenter. And I would like to introduce you Dr. John Barry, psychologist and professional researcher. He is a leading expert in the areas of male psychology, including men's mental health, and associate fellow of British Psychological Society, honorary lecturer in psychology at University College London, UK. And he is presenting keynote men's mental health, why we need a fresh approach. So we will see Barry on the screen.
I'm afraid you're not going to see Barry on the screen just yet.
Yes.
You'll have to wait until after I've done my lecture.
John, can I interrupt a little bit? We want to see you. Can you stop sharing your slides? Just we want to see who is talking.
Yeah, you can see me at the end of the lecture. Well, because I'm going to be speaking for an hour, I think, on the panel, or half an hour or so.
Yes. So you will have time 5 to 55 minutes, and
Yes.
then after, if we have questions, maybe we can answer.
Fantastic.
All
Thanks.
right, thank
To
you.
be absolutely honest with you, I think I've just about got this set up right now, and if I try and put myself on the screen, I'm not going to get the rest of the presentation back. So you either get to see my face for 55 minutes, or you get to see some interesting slides.
Okay, we will try imagine who is talking now.
Right. Imagine somebody very handsome. That's all you need to do.
Thank you. You can go.
Thank you. Well, thanks to the organisers for inviting me here today. It's, I think, a very important conference. There's been some really interesting speakers so far, and I hope what I have to say adds to the whole day and helps people to move conversations on in interesting ways. So my name's John Barry, as we just heard here. And to give you a little bit of background on about myself, you heard about me being a psychologist and being interested in men's issues. Actually, I started out researching the psychological aspects of PCOS, and I have quite a few publications on that. Polycystic ovary syndrome is a condition that affects women and causes some of them to have high testosterone levels. And, oops, somebody trying to take over my thing here? High testosterone levels. And in fact, that was the subject of my PhD, the psychological aspects of polycystic ovary syndrome. But what got me interested in men's issues was that while I was researching and working for years studying women's mental health, I was aware and increasingly disturbed by the fact that we didn't have any provision for men's mental health. So I kept on hearing about suicide statistics year on year, and it never got any better, and nothing seemed to be done about it. And when I say nothing, I mean nothing within the psychology of, within the profession of psychology in the UK or elsewhere, as far as I could see. So we started up the Male Psychology Network. This is the slide I keep trying to show you here. This is us at one of our conferences in 2016 at UCL, where I was working. And these were really good occasions where people could get together, like myself, and share our ideas about how we could improve men's mental health, because it was, and still is to some degree, being overlooked. Since 2018, we have had a male psychology section of the British Psychological Society. Now that's something that my colleague Martin Seeger, consultant clinical psychologist, had been campaigning for a number of years for, and we eventually got it. And I would encourage anybody to keep at their organisational bodies to see whether they can get them to create some sort of forum where you can discuss men's mental health issues and other psychological issues too, whatever they might be. Now, the kind of question that we started off with originally was, men die by suicide more than women do, and this is international. It's like, you know, in many countries, it's about, the international average is about 3.7 times higher suicide rate in men than women. So why do men seek therapy less than women do? Now, this was something that we thought was a really interesting question, and one that we fairly quickly started to address. But to look at the way things are for men, you know, why don't men seek help as much as women do? What kind of help is available if you've got a mental health issue, you're very stressed out about something? And so what we did is we looked at the various types of help available. So, you know, there's 5 different areas in which they might find help. One is the kind of friends and families approach, where people will do, I think, what's kind of comes very natural to a lot of people. You kind of reach out to people around you. And, you know, if you feel that you can't reach out to those who are close to you already, sometimes people will ask a teacher or ask a community advisor, some kind, like a religious leader, priest or something. And so this can also be quite a useful thing to do. I mean, the important thing, of course, is that people are reaching out when they've got issues and not keeping it to themselves. But if you don't think that these kinds of sources of help are appropriate or useful, or you don't want to do them for whatever reason, you could then go to one of the helplines. As a man, there in the UK, there are now, in recent times, been some quite useful helplines. So a lot of men become very distressed and suffer in terms of their mental health because of being a victim of domestic violence. And most often this is domestic violence at the hands of a woman. And lots of people don't want to talk about this, and you know, people don't often react well when they find out about this. But we now have got quite effective helplines along these lines. We also have Families Need Fathers, and this is for men who find themselves in the very difficult situation of being in family breakdown, and where they're losing their family, and most painfully losing their children often, and so they have helplines for speaking to people there. And then we have also got some helplines for false allegations of sexual offending, and this again can be a really difficult thing. And these sorts of helplines, I mean, they're dealing with the kinds of mental health issues or the kind of issues that cause mental health problems in men, and very severe ones in a lot of cases, that don't often get really much provision if you think about the kind of training that a therapist, a counselor, psychologist will often get. It might not be around these sorts of issues. And in fact, some types of training will quite badly equip people to deal with men who are victims of these sorts of issues. And then there's something that's very popular at the moment, which are talking groups. You've got groups of men get together, and there's actually quite a lot of them in the UK. They get together, they're usually informal, peer-led. They're not necessarily trying to do therapy of any kind, but really just trying to get together and talk about what's going on with them. And I think these are very valuable, but they tend to be quite unstructured. I mean, they're informal and they're not led by professionals. And if you really have got an issue that you really want to get professional help for, the natural thing is to go to a trained therapist, usually on one of the kind of recognized registers. So we have therapy in the UK. You can go to therapy privately and pay for it, or we have what's called the National Health Service here, and the National Health Service has actually come up with quite a good program of trying to get people to access therapy as efficiently as they possibly can, kind of streamlining the whole approach. And this is called IAPT. And IAPT, in theory, should be a really useful thing. And in fact, it sees about 1 million people annually for depression and anxiety. It offers a range of treatments. There's a kind of a stepped approach to access. You can start off with kind of, less challenging therapies and move on to more challenging types of therapies. So it's really good. I mean, the only problem is that 2/3 of the people who go to these therapies are women. So there's a lot of men. They're out there. They're dying by suicide, but they don't seem to be accessing therapy, even when it's free and even when it's reasonably quite accessible to them. So you have to then wonder, what is happening to these men? They're often called the kind of hard to reach men. And I think sometimes people dismiss them as just being people who are hard to reach. I mean, they're not making themselves available. And we don't really know what's happening with them. And if you look at the data for what's happening with the men who go to therapy, that's not really representative of what's happening with the men who don't go to therapy. And if you think about it, a lot of the men who don't go to therapy might end up self-medicating with various substances, and they might have untreated emotional issues where they lash out, become violent. They might end up in prison. They might end up homeless. There's lots of bad ways that things can go with untreated mental health problems. So, and this is the kind of thing that we realized that we were up against when we started doing our research. This landscape of therapy that wasn't being taken up, and a worrying kind of hinterland of men who are possibly just going to early graves for one reason and another, and not getting help by the psychology profession. There is not very much research on differences in outcomes of therapy for men and women. And this is, I think, quite strange. It's one of these things that is a result of our tendency to think that these days that men and women are just the same. There's no differences. People tend to discount any differences as being superficial. They're not differences that we should take seriously. But actually, in practical terms, I mean, so this paper here is by it's one of the few papers that's looked at the longer term outcomes of counseling therapy. And I think it had over 300 men and women in this study. And what they found was that men and women did equally well in the short term. This was brief counseling therapy, part of an employee assistance program. Men and women did equally well in the short term. But in the longer term, women actually improved. Their mental health and various outcomes got better. But for men, they went right back to their baseline levels. I mean, they were as bad 3 months after their therapy as they were at the very beginning of therapy before they started. So this should be extremely worrying. This suggests that in a way we encourage men to go to therapy, but do we really know that it's going to work for them? And it might even hint that men might not go to therapy because they think it might not work for them. So we do, I think, still need a lot more research, but certainly this was what we were looking at when we started out with the Male Psychology Network, researching these issues. So we're interested in the kind of barriers, the kind of obstacles that men faced in getting into therapy. And one of the things that you hear a lot is that's masculinity is the barrier or the obstacle for men seeking help. But when you actually look at the data and you look at the circumstances of men answering surveys of this kind, you find that actually the barriers are a little bit more tangible than something like masculinity. So that there might be something to it, but it's actually, I think, when you focus too much on masculinity, it makes you overlook the other issues and the other issues that might be a bit easier to deal with than trying to change somebody's masculinity. And so, for example, if a man, one of the things that we often hear is, and it's true to a degree, men are less likely than women to recognize that they have a problem, and they're less likely to admit that they have a problem than women are. And this is true. But when you think about it, what does it mean for a man not to recognize that he's got a problem? In some cases, if we take the example of prostate cancer, sometimes the symptoms are very subtle, and somebody might not notice that they have a problem. And it's a little bit the same with mental health too. I think sometimes the type of symptoms of depression that a man might have might not be the same as the ones that we think are typical of depression. So men who are depressed might become more irritable, they might become angry, they might drink more. So they kind of act in a different way than we expect, and a different way than they would identify themselves as being about depression. So often I think men don't seek depression because they don't recognize it as depression in themselves. And there's another thing too of they might reckon that the stress that they're experiencing isn't really a mental health issue. It's an issue caused by something that's happening in their life. So, for example, if the stress is to do with a divorce that they're going through, they will want to lawyer up so that they can deal with the divorce issue, all the messiness of the legal situation, in an effort then that they will then feel better. So they don't really necessarily recognize that what they're experiencing is something called depression because they think it's not a mental health issue, it's a legal issue. And there's the whole thing of shame. I mean, a lot of people feel shame. There's stigma around going to seek help. In research that we've done with the Male Psychology Network, we've actually found that the levels of shame and stigma are not that different amongst men and women, which is a bit surprising because you hear a lot that it is. But I think there's various ways that people are already working on reducing shame, and I think that's working quite well. As I said, things like men's talking groups and other programs like that are really signing up a lot of men. So I think the shame issue is probably working itself out already. A trickier issue is that men tend to distrust doctors and healthcare workers more than women do. It's a general thing, but it also might apply in specific ways to men. For example, I said about if you have a male victim of domestic violence and the perpetrator is a woman, he might have a hard time finding a counsellor who's going to be sympathetic to him or even believe him. And men are often not believed by the police in these sorts of situations. So that's a particular issue that doesn't get flagged up, and it's not really about masculinity or anything like that. It's just about whether you want to go and talk about a highly sensitive issue in your life with somebody who might not believe that you are not the person who's the perpetrator of it. And there's also the issue in more recent years, I think, especially of men distrusting therapists if they think that they're going to be, if the therapist is not male friendly in some way, if they think that the therapist is just going to, like the domestic violence victim, just going to blame them for the problem that they're experiencing. So that's an issue too. And we have, I think, this lack of confidentiality and a concern that that's what they say in therapy is going to leak out. I think this is quite a reasonable concern. I mean, you definitely don't want to tell somebody something highly personal. Or if it's about some workplace issue, you don't want to tell somebody who's going to report it back to your boss. I mean, this could be a disaster for you. So we have the issue of confidentiality, which affects men and women roughly the same level, according to our research. But I think it's a real issue. And again, not really anything to do with masculinity. An issue that most people can agree on is that there are what's called concrete barriers, such as a lack of finances or a lack of insurance, or just not living in an area that has a suitable therapist for whatever the issue is for you. And we find that men are reluctant to go to therapy if the concrete issue is they've got to take time off work to go and see a therapist. So there's those sorts of issues that can be solved by having more flexible out-of-hours times for therapists. But it's, the concrete issues are a serious issue too. And then, of course, it's a bit like the hard-to-reach men. You have the men who just believe that in their particular circumstance, the therapist just won't understand their problem. I know this, I've spoken to a chap who works in central London, and some young black men who go through kind of quiet experiences by a lot of people's standards. They just won't go to an ordinary therapist because they just see them as being white, mostly middle-class women who won't really be able to understand where they're coming from. So this is a key thing, I guess, with therapy, isn't it? You know, you really need the person who you're opening up to understand you or be willing to try and understand you, or at least not completely misunderstand you. Now, if we kind of take a step back and look at compare what the situation is in psychology to medicine, we have, in medicine, people recognize that there's some medications that you can't just, you know, give them out in the same way to men and women, because you might get some quite toxic effects if you to women. For example, it tends to be women who get the more toxic effects when there is one. And we don't, it's well recognized in medicine, we don't really think about that in terms of therapy. We don't think whether one particular type of therapeutic approach might be more acceptable or work better for women than men. And it's something worth considering. There have been some little bits and pieces here and there in the literature highlighting that, for example, and this is a quote from an infertility counselor who said that it's essential that infertility counselors be aware of how men and women experience infertility differently. For example, the common dynamic where a man attempts to help his partner using problem-solving strategies to protect her from her emotional pain, leaving the woman feeling emotionally invalidated. So what's that saying is that a man is taking a problem-solving approach. He sees that there's a problem, he wants to fix the problem, whereas the woman is inclined to kind of maybe just want to talk about how she feels about the problem a bit more. And when she's not listened to in that way, or feels she's not listened to, you know, that can be quite hurtful. So, and I think this hints at a dynamic that might be more widespread than we tend to recognize. And in fact, there are some people who think that the mental health services fall into this trap of catering to a kind of what they call a feminized view of therapy, which is asking people to talk about their feelings, which is something that women in general, and of course we're talking about kind of population level in general, things about women and men, but women in general, in as much as you can talk about these things, tend to want to talk about their feelings as a way of dealing with a problem, whereas men tend to want to fix the problem more. So the kind of talking therapies that we have tend towards this sort of talking about your feelings rather than fixing the problem type of approach. And there is some research that there are sex differences in outcomes in therapy. This particular paper is interesting, but doesn't really kind of go into why there are differences. It cites there's about a third of the papers that looked at sex differences in therapy found that there were differences in the outcomes. But it points to the fact that we're lacking in research here. But we did our own research ourselves. So, for example, we started looking at the opinions of life coaches. We chose life coaches first because we thought that that's a kind of a solution-focused type of therapy, more so than, say, psychodynamic therapy or something, or counseling, where you're talking more about your feelings. So we asked these. We did a ground theory analysis of interviews with 20 life coaches. And we found that although it was very interesting, and it's one of the things I like about research, you never really know what you're going to find when you start out doing a research project. We kind of did expect coaches to talk about sex differences in aspects of their work. And we found that 90% of the coaches talked about sex differences in aspects in some aspect of what they did, like in terms of the clients, the way they sought help, or the kind of help that they responded to best, that kind of thing. But 2/3 of them in their interviews showed a kind of a reluctance to identify sex differences. So they might say at the beginning, well, actually, I don't think there are any sex differences in anything that my clients do. And then a couple of minutes later, they'd be talking about how men tend to want to talk about their work life, whereas women want to talk about their relationships. And we got a lot of that kind of, it seemed to be cognitive dissonance around talking about sex differences. And I think that's probably quite true of a lot of what's happening. So we did another study about a year or so later. And this time we talked to counselors and psychotherapists and clinical psychologists and counselors. And we asked them similar questions that were basically a very open question. Do you notice any differences between men and women in terms of any aspects of therapy that you do with them? And we found this time that there was 100% of the people that we asked identified sex differences of some kind. And again, even more in this study, I think it was about 80% of the people who responded seemed to be kind of reluctant to talk about these differences. By now we were just thinking this is really, really interesting. They're saying there are differences, but they're kind of almost apologetically telling us about sex differences that they're noticing. And we started to find that these things were forming a bit of a pattern. And we found that people who were saying that they worked with men in a particular way were telling us that they didn't have, like their training didn't prepare them to do this. They had to find it out by themselves through experience as a therapist. And this is kind of, that sort of what we call gender blindness, but male gender blindness, I think has increased over time. We now have almost what's called a politicization of the clinical psychology situation, where we're really not focusing on sex differences at all anymore. And I think it's a great opportunity to do so, because we did a small study with clinical hypnotherapists and found that all of the hypnotherapists found that there was differences in one way or another with their clients. None of the hypnotherapists in this particular case had any problems in reporting them, though, which is interesting. And it could be a difference in the culture of the training of the hypnotherapists compared to the clinical psychologists and the counselors and the psychotherapists. So I think there's something that you could probably call beta bias going on. I mean, this is a phrase coined by some psychologists in the States. It basically means that we tend to want to look at gender similarities rather than gender differences. So we're quite happy to talk about how men and women are the same, but we really kind of get a bit squeamish when we talk about gender differences. And in fact, maybe a lot of you are there feeling a bit uncomfortable thinking about it now. But of course, I'm taking a practical standpoint here. I just think there's a lot to be gained by identifying any differences in men's and women's preferences or experiences, because it might well mean that you're improving therapy for, well, especially men who are not turning up to therapy as it stands. So we did our own research, and we looked at, I think it was around 350 men and women, half who'd been to therapy and half not. And we found that of these people, when we asked them, if you had a mental health problem, what kind of treatment would you like to have? This is a table of some of the results that we got, similar in other tables. We found that there was significantly more, women significantly liked significantly more psychotherapy more than men did. And it was the opposite for support groups. Men tended to like the idea of support groups more than women. And this psychotherapy difference with women preferring psychotherapy, I think speaks to this idea of wanting to talk about feelings and being more interested in doing that as a way of dealing with their problem. Whereas the support group, the way this was described in this particular scenario, it was a more practical thing. It was about sharing information. but still, in another table of study, we found that men also said that they liked the idea of group therapy more than women did. And this, again, a little pattern where men seem to be more inclined to want to work as a group. And if you think about men working as groups, I mean, there's loads of different groups you might think about, like kind of football teams and, you know, military squads and all sorts of different ways in which men really work together as a team very well. And it seems to extend to the way they want to do therapy too, to some degree. Like men and women all preferred individual one-to-one therapy, but the men seem to be less put off by the idea of working in groups with other men. And you can see that a lot. I mean, just in the community, there are lots of support groups popping up all over the place, and they seem to all just involve men feeling okay about getting together and talking to each other in groups. A bit, and this All for One for All kind of reminded a bit of the Three Musketeers, this idea of sticking together, which men apparently, I haven't done group work myself, but apparently men do tend to be quite supportive of each other, like even, you know, kind of supporting other people more than looking for support for themselves. And just it's just important to note, like when we're looking at research like this, in a lot of cases, when you're talking about, it's a bit different in private therapy when you can choose your therapist and you can choose the type of therapy if you know what you prefer. But for lots of, in other scenarios with the NHS, you don't really have any choice about your therapist or the type of therapy. You just kind of get what's offered to you mostly. You know, if you can make some sort of choices, that's brilliant. But in general, when you look at research on differences in men and women in therapy, you have to check whether they actually were just in a study randomized to one or other type of therapy, or whether they actually had some sort of choice. And so, I mean, I'm not trying to say, by the way, and this slide is a fairly poor way of me trying to explain that it's not a one-size-fits-all approach that I'm trying to say. I don't think that all men are like, you know, prefer this or deal with their issues this way, and all women prefer to deal with things another way. It's definitely a case that, like, in fact, what we're advocating in terms of like a male-friendly therapy, I mean, that might work much better for some women than a kind of feelings-sharing approach to therapy. So, you know, we just think it tends to be a kind of a more male typical thing, but it's definitely not saying men are like this, women are like that. You know, it's none of that. It's really kind of client-centered. It's an extension of just a client-centered approach, and just recognizing that your client, if they're male, they may well just have preferences. They might not, but they may well have preferences in a particular direction. And so, having done some research on this and looked at others, the research of others and case studies, we've written a chapter that a lot of people have found quite useful about the factors that make a male-friendly therapy. And we've also, the British Psychological Society has published guidelines authored by myself and Martin Seeger on doing therapy with adult males. And and we're basing this, I mean, the caveat is that there's not a great deal of research. I mean, there's no randomized controlled trials. So we're at the very early stages, and trying to get funding for any of these activities is, you know, almost a non-starter. But we've got some guidelines based on what we know. And I mean, some of it can be quite useful. In fact, I've just included a link to where you can find these guidelines if you want to use them. You can download them for free. So this is the Male Psychology section website. And if you go to that link and you go to this tab and you go to Papers and Publications, you'll find that we've got those. It's just, there's 3 documents there. One is our practice briefing on therapy for men in English. One is in Portuguese and one's in Lithuanian, thanks to Antonis and his colleagues. And in our practice briefing on therapy for men, we say things like this, and it's kind of quite important. A male-friendly approach is not a specific type of therapy. Okay, so it's not a specific set of rules. It's not a one-size-fits-all solution, but it's an approach based on men's communication style in relation to help-seeking and coping with stress, which can potentially make a given therapy more acceptable to male clients. And when we say a given therapy, we mean pretty much any kind of therapy can be male-friendly as long as you approach your male client in a particular way. And that particular way doesn't involve just sort of, people tend to like to hear things like how do I work better with men? How do I improve it? Oh, you use this sort of language, or you adjust yourself to this sort of behavior. But I mean, there are some things that are a bit interesting. In the UK, we have a term banter, which is about kind of a teasing sort of jokey style humor. But sometimes therapists find that their male client turns up and they haven't met before his first session, and he starts making jokes, or he starts talking about football, and the therapist is a bit thrown because it's just think this guy's, he's a joker, he's not ready for therapy, he's not taking this seriously, and that might be the end of it. They might close down the situation. But we understand, like, from a male friendly point of view, this banter might be just a kind of a communication side that doesn't really have any bearing on the person's readiness for therapy. They might be just using the humor as a way of trying to make a connection with the therapist, or like seeing if they can work on the same sort of level, if they identify with them or not. But in general, taking an indirect approach, I think, is a wise idea. So not starting off with kind of, sit down and talk about your feelings type of thing, but being a bit more indirect and maybe taking a kind of more coaching or problem solving or CBT type of tack. And then moving on, because, men do benefit from talking about their feelings. There's no doubt about it. It just needs to be the right situation. And I think the overall thing from my research anyway into this area and with colleagues is it's empathy. And this is really it. And this is, in a way, it sounds simple. Yeah, okay, I got it. All I got to do is empathize with this person. And of course, therapists think, oh yeah, we're all empathic. I mean, but it's actually really quite difficult. It's really quite challenging. Because it means trying to kind of step into the shoes. For example, we're just taking the domestic violence victim again, so that the guy who is being, and he might be a big guy, and he might say that his wife or his girlfriend is, 5'1", and trying to empathize with a guy who said he's being, his life is being wrecked. He's depressed. He may be suicidal because of this. And if your idea of relationships has no bearing on that, if you think that, if you tend to see that men are usually the dominant person in a relationship, or the dominant people in general, you might find it hard to believe what's going on with this guy. And this is where empathy is absolutely vital. And without empathy, I think lots of people will agree that therapy doesn't really go anywhere. So, as I said, I mean, men are already kind of, I'm a psychologist, I'm trying to find different ways of doing psychology, trying to get men into the therapy room. But men are already kind of voting with their feet, as we say. Like they've decided that they're going to do other things, and they are. They're kind of out there. They're doing things like men's sheds, where they might get together, and like the original thing was just men getting together and fixing furniture together, and no intention of therapy whatsoever. But they just found actually that the guys their moods seem to improve tremendously by doing this. So it's now kind of almost prescribed for socially isolated men. It seems to be working very well. And there's all sorts of other groups. There's walking groups and, all stuff that I think is really good. I mean, it seems very simple, and you kind of think, well, is this really therapy? Well, it is. It lifts these people's moods. And I should also, another caveat, I mean, we're not trying to replace therapy or replace the importance of therapy for some conditions, but these are kind of ways that seem to help men who are in situations that are causing them stress, and they're not inclined to go to a therapist. That they will go to these things like the sheds or the walking football or the kind of the the talking groups. And so, what can you say? This is what they want. And I think it's useful to sometimes kind of step back and look at the big picture on some of these issues. Like we have, the big picture is escaping me here, but we tend to look at the individual, but really the individual exists within a kind of a network of relationships, a network of organizations like workplaces or schools. They're within a community that has ideas about men. And of course, there's also, and people have mentioned this, public policy. I mean, we have policies that are supposed to impact every aspect of our lives and supposed to impact our lives for the better, of course. But let's have a look at how this works out. If we look at some of the public policies that we have, and I want to mention, I know that there's some people who are using the GG and also and other similar instruments based on the public policymakers like the OECD and the WEF. I mean, these are good in a way for identifying the kinds of problems that women are facing, but they're kind of, when you say gender equality, and I mean, who doesn't want gender equality? But when you talk about equality, really equality means kind of some sort of fairness for two parties, say. Whereas these instruments, they only measure inequality against women. They literally don't measure inequality against men. So they end up kind of, identifying when they're used, all sorts of inequalities that are against women. And it kind of spreads the impression that women are the people who have it bad everywhere in the world, because these are global organizations, the WEF, OECD, and they share this information with the UN, with the WHO, with the governments all around the world, through the media, press releases, and it spreads the idea that women are the people who have it bad, and kind of by implication, that men are sort of, kind of cozy and have it easy, and there's no disadvantages against men, because we don't see them when we do our research on gender equality. We don't see these disadvantages that men are experiencing. But of course, I think, probably a lot of people are aware, suicide, 3/4 of suicides are male, and, it's kind of a similar sort of thing, kind of goes up and down a bit in different parts of the world. Homelessness, I mean, in the UK, about 80% of rough sleepers are men. 95% of the prison population is male. The educational levels of boys has been kind of going down for years. But we don't really think about these as being problems that we need to fix. We tend almost to blame men and just say, well, you're not going to therapy. We shouldn't be drinking so much. Well, if you're a boy failing in school, well, why don't you just sort of sit still and do your homework? Why are you drinking energy drinks? Why are you wanting to just go outside and play or do naughty things? We don't really seem to kind of be aware that these might be issues that we should take seriously. And another area that I found, I mean, at the beginning, I mean, we were interested in suicide, and we wanted to know why are men killing themselves so much more than women are. And one of the things that kept coming up was family courts and men really having a rough time at the family courts. And I, like a lot of people, I think, just thought, yeah, that's what this old kind of father's rights thing. And but actually, after a while, I just started realizing it, like speaking to more people who are, experts in this area, and then doing our own research, as you can see here on this slide. I'm finding that actually men going through the family court system really did have a terrible time of it. And it wasn't that they felt bad that they were losing out financially or anything like that. Their main source of distress was that they weren't able to they lost contact with their children. The courts wouldn't let them see their children as much as they wanted to. In some cases, they felt that their children were being turned against them by the courts, so that they lost their relationship with the children. And this was devastating for these guys. I mean, like, and of course, you might add bad for the children too, bad for everybody. But if, it seems like, a lot of the a kind of a sizable chunk of suicides are related to guys who have been through this sort of process, and it might not be in the immediate term, it might be in the longer term, so harder to connect with what's happened. But it's these are the kind of issues I think that we don't really empathize with men in these sorts of situations, and partly because we have policies that produce evidence or supposed evidence that actually men have it relatively okay. So another question. Surely psychologists are trained to have empathy. Of course, we're aware of men's needs and sufferings and things. I'm just going to quickly go through these last few slides here. But I think it's important just to recognize for psychologists, I know not everyone here is a psychologist, but up to the 1980s in psychology, we would describe masculinity as being about active, dominant, self-contained, and aggressive. And fast forward a couple of decades, and we now think of masculinity as being about misogyny, it's bad for your physical and mental health, it's about being homophobic, and even related to sexual assault. So we've gone from, like in a few decades, a kind of a picture of men that's relatively benign to a picture of men that's really kind of quite monstrous. And you have to kind of wonder, what kind of effect this has on men and boys too. I mean, is like when you're living in a society that feeds you these sorts of messages, how are you going to feel? How will that affect your mental health? And then there's the whole question, is masculinity bad for your mental health? I mean, a lot of people seem to think that it is. The research you'll find a lot of research that seems to suggest that masculinity is bad for your health, mental health and physical health. But it's been pointed out early on, and this is an interesting paper by Glenn Good and colleagues from 1994, just when this sort of deficit view of men had been taking off. There were a few voices at that time saying, hang on a second, are we sure we know what we're doing here? We seem to be redefining masculinity in this very negative way. And how are we doing this? Like this particular paper is looking at the way that these studies were researched. And it was pointing out that actually the way we're researching this is a bit, it's not using the best methodology. For example, a lot of the research that was finding that masculinity was kind of about drinking too much and repressing your feelings, it was done on kind of quite young men, like college-age men, rather than being done with older men. Like once you get past about 30 as a man, you're kind of quite different than you were as a teenager or even in your 20s. But if you just do research on using men in their early 20s, you get quite a kind of a specific kind of snapshot of what masculinity is, but at that time. And it doesn't really generalize to older men. And I would argue too that a lot of these concepts don't generalize around the world very well either. I think that, I think a lot of people recognize that the masculinity can be expressed differently in different cultures. So I think it's wrong to presume that it's a negative thing. And then to generalize this negative view, we did a survey and we found that 85% of people that we asked about whether they thought that the idea of toxic masculinity might have a harmful effect on boys. 85% of people agreed that it might do. And I think this, and when I saw that, I thought, well, I agree. I think, talking about in the social media and the general media, and even in schools, there's a recent study found that I think 27% of boys in UK schools have been exposed to the idea of toxic masculinity in the classroom. I think that this can be, it can skew somebody's idea about themselves in a negative way. And 85% of people thought that there might be something to that. I've actually done some recent research. It's coming out quite soon. And this was with 4,000 men. And I found that, oops, what's happening here? Oh dear. I don't know what you can see here. 4,000 men finding that that's basically the men who thought that masculinity was bad for their behavior, caused them to have bad behavior. These people, oops, Okay, I'm losing the screen from my perspective here. But the men who thought that masculinity was bad for their behavior, their mental well-being was significantly reduced compared to men who thought that masculinity was good for their behavior. And we get fed a lot this idea that masculinity is bad for, is toxic. It's a kind of it's at least a risky thing. If we don't kind of correct it or shape it in the right sort of way, it's going to go wrong. And I worry that this is, my findings in this study of 4,000 men, finding that these negative views, when you internalize them, it's bad for your mental well-being. I'm worried that that's replicating in lots of kids growing up too. So I've only got a couple more slides here. They're probably great. I think we're going to have to miss them. You are going to get to see what I look like in a second because I've abandoned my slides. Am I back? Am I visible to everybody? Okay, I think we're going to say that's the end of my lecture and time for questions.
Oh, yeah. Can we see the Barry?
Okay, yes. Can we see the Barry? Where is the Barry?
Yeah, we see you. Yes, we see you.
Oh, you do?
Now.
Brilliant. Okay.
Yes, yes,
thank you. Hello,
yes.
everybody. No questions about IT, please. Obviously, I don't know anything about that.
So, who has a question from the audience? Yes, there is. Just 1 minute. I will bring a microphone that also you, John, will hear the question.
I'd just like to thank you. It was a very interesting presentation, and it's good to dig in those topics like toxic masculinity, because now it's going a lot of discussion about this. So I'm looking forward to look more in your slides and in that literature you provided to dig more in. Thank you.
Thank you. Oh, I should say, if you want to find out more about the literature, I did have an email on my last slide, unfortunately. I'll just say it quickly, John Barry, JOHNBARRY, at malepsychology.com, malepsychology.com. And also our website's got some of the publications too. So the Center for Male Psychology, if you look under the publication tab, you'll find good number of papers there for free.
Okay, thank you for question and answer, John. We have one more question.
Okay, thank you.
Hi, I'm Alexander from Kvinfo in Denmark, and thank you for the presentation. I think it was a very interesting discussion about whether masculinity is the barrier or not. And I think it's very important that we are very precise when we discuss that, about what we mean when we talk about masculinity. I think your example is very important, that when a man does not seek support when he's a victim of intimate partner violence, maybe it's because that he will not be understood or believed by the authority. And that's something that we've seen in Denmark as well. But I don't think I agree that it's not about masculinity. Because I think maybe there's a divide there between talking about masculinity as a personality trait and something that this man wants to live up to, and then masculinity as a gender norm, an ideal in society that influences this authority to not believe this person. And when we in Kvinfo, and I think a lot of other organizations with a gender equality perspective, talk about masculinity norms and gender stereotypes, it's not about changing a single person or even men as such. It's about changing the gender norms in society and the expectations that men are met with, for example, when they go to the police because they have been the victims of violence.
Yeah, this whole thing about gender norms and expectations and stereotypes, I think that we get fed false stereotypes and norms about masculinity. Sometimes I think the idea of masculinity that we're supposed to be all living up to is somebody like Henry VIII, or like some very sexist, monstrous sort of guy. Almost nobody, I've probably met a couple of people who are like that in my life, But most men are not like that. I don't think we're supposed to be even thinking that we should aspire to that. But we're told that these are what the norms are. I just don't agree with that they are. If you take, there's one interpretation of masculinity, which is that it's a kind of social script, and it's about being a provider and a protector for your family and the community, being a fighter and a winner. So like kind of going out into the world and kind of achieving something, getting something. And also being able to kind of control your emotions when you need to. So like not getting, and the reason these develop over eons and have evolved is because, men have been through situations where we have had to be the protector in times that are quite dangerous. And so under those sorts of pressure situations, you should be able to keep your emotions under control, or else you're just going to, run off kind of, home and won't be any good at defending your community. So I think that there's something useful there. But also you can adapt these sorts of things. I think any social script can be adapted. So masculinity, like you can say, well, it's a strength to reach out and get help from somebody who can help you. It's weak to kind of to just be completely defeated by something and not seek help. So that's playing up this kind of masculine kind of ideal about being strong and not being weak. But it's not a negative thing. It can quite easily be a positive thing. But we never hear about any of the positives of masculinity. Actually, I was going to tell you in a few of these slides about some of the research that's found that men do exactly these things. Like men, who are suffering from depression, they say, okay, well, I'm not going to do nothing. I'm going to phone that GP. I'm going to get a prescription. Or they might do kind of very action-orientated things. Like they might kind of, like there's examples of guys who kind of formed a motorcycle club. Like they all were suffering from depression, felt miles better after it, kind of just going around kind of, building bikes, putting them together, so there's some sort of, social interaction. They felt miles better. Was this a kind of a too macho a thing to do? I don't think so. I think we have to accept that if people want to gravitate to these particular things, they're not doing any harm. Why should we look down on them? And why should we have just say that masculinity is this negative thing? It can be a positive thing. And I think if we had more people devoting a bit of time to researching how we can harness the positive aspects of masculinity instead of just focusing on the negatives or the potential negatives of masculinity, I think everyone would be hugely better off.
Thank you, John. I see no more questions. Thank you for presentation and thank you for your answers. I will ask you to be here for the discussion if you are available.
Of course.
And now we will start our panel discussions. I would like to invite second part of the panelists to the chairs, and I will introduce you there, and we will hear your presentations in a moment. Yes, so everyone here? Okay, you know Barry, Dr. John Barry on the screen, so you know him already, and now we will try to know everyone else here. So we have here Jonas Kekkonen. Yes, and he's from Messaget Rai, Finland, Head of Education and Development. After that, I will ask you to present yourself a little bit in depth. And also Ole Johan Rosentrom, Men's Forum Norway. Ulf Calvert from Men's Centrum Sweden. And Gaitis Midrovskis. Your organization is TEVI, so it's an NGO for fathers. Yes, it's a very nice name, like TEVI. From Latvia, and also Antanas Grižas from Lithuanian men's tribe called Gentis. He is also clinical psychologist. Welcome here. We will try to talk more about men's emotional health and mental health. But first of all, I will ask you to present yourself, and some of you want to present with slides, some of you want to present from the place. So as you wish, it's not mandatory. So those who want to go first, let's. Okay. Oh, see. Yeah, let's come. There is a password.
Yes, thank you for inviting me here. And I'm going to do a very short presentation of where I come from, my context, and what we are doing. My name is Ulf Calvert. I'm a licensed psychologist, clinical psychologist, working in Stockholm, Sweden. And Manscentrum is an organization founded in 1988, so we have more than 35 years of practice in supporting men in crisis. So we say that the crisis center for males, and the crisis is crucial for our work because there is a momentum for motivation to deal with our problems. We are organized as an independent foundation, so we are not in a huge system. We are quite a little organization supported of the local community and some other foundings. And we have 3 business areas, we would say. Is a professional treatment, individual and group therapies, so I'm going to talk about that more. And we also have this helpline, Choose to Stop, which is for perpetrators who wants to have support to change their lives and change their patterns in the close relations. And I'm also an operating manager of that line. And so some hours a week, I sit in the telephone and in contact with perpetrators who usually call when they are in a crisis. An incident has recently happened, and they are really nervous, really vulnerable, and don't know what to do in that kind of situation. And our job is to meet them where they are and support them, motivate them, and direct them into treatment in their local municipality. We also have Manscentrum Education, which I'm also involved in, which means that we share our experience of being a crisis center and dealing with men and being male-friendly, hopefully. And we're also a member of a Rikskriscentrum, is a national crisis center for males in Sweden, which is organizing about 28 organizations in Sweden working with perpetrators programs. Okay. Okay. In numbers, we are 8 to 10 therapists, 2 administration staff. We see about 400 to 500 clients a year. 95% are male, but we also have 5% of females. And when we talk about the females, there are, of course, we have support for the victims of the men that are seeking help in our treatment. But there are also women with their own anger and violent behavior, which there are actually very few who work with in Sweden. So then we work with them also. 40% general crisis, a lot of different crises in men's world, and 60% is domestic violence. So that's the major part. So since 35 years ago, we have like 17,500 clients, more or less. And as in MUM, it's the same. They are our ambassadors. They are supporting their friends and say that, yeah, there are help to find. So we have no problems with finding clients. Referrals comes, you need to call by themselves. And they are referred from psychiatric care, family consultations, social service, and so on, a wide range. And also, of course, the helpline Choose to Stop, which also directs a lot of the men to the treatment in MUM syndrome. And the clients are a very heterogeneous sample of men from all kind of class and backgrounds. And that's quite interesting, because in one session I can have a lawyer, and the other session I have a carpenter. And I need to be able to cope and to, which I call, dance with everybody. And that's also making this is a very nice work. Our clients are from 20 to and up, I would say, but we can see that we need an opportunity also to work with the younger. Perhaps we shouldn't do that, but there need to be more of facilities for younger men, because we have a little difficulties to refer them in our country. 15% born outside Sweden, yeah, and the majority is middle-aged. And that's one of the problems. That's why I talk about the younger men. Most of them are like 30 to 45 who calls us, when they have family, kids, and so on. But they are usually starting, the problems they have in close relationships starts usually around teenage dating, you know, with all this jealousy and violence and so on. Yes, yeah, we all, yeah, I don't mention anything more there. And I would say that when do the clients seek treatment? And we usually say that the crisis is the motivation, and it's quite obvious that the men, our design, how we work 1 to like 10 sessions, more or less, and there need to be a crisis there to break up, and the anxiety usually is quite helpful there to break the defense system, and they are quite vulnerable and quite willing to start to work with their emotions, which I think is quite quite good. It's of course a quite painful situation for them, but as a therapist, wow, this is gold. Yes, I stop there.
Thank you. Thank you, Ulf. And then I would like to invite Ole Johan to share his experience too.
Yeah. Okay. Sure. Happy to be here. I'm honored to be here. I'm just a carpenter. Have no. This is just volunteer work group in Norway. And I'm representing, and I'm also proud of it because of this. So I'm glad to be here. I'm from Men's Forum in Norway. My name is Ole. I'm a substitute in Men's Forum's board in Norway. And I'm a deputy chairman in Men's Forum Public Help Service in Norway. Men's Forum is an 11 years old organization in Norway. We started out in Oslo in 2012. Around 20-30 men soon got together, demonstrated outside our parliament. They had a big sign that said, "Stop neglecting fathers who just want to be with their child." That was a fair game, easy to understand, but nobody listened. So a few years later, we were around 200 members. We had reached like our peak of doing what we were doing in the fashion of screaming in a loudspeaker in the streets of Oslo. So what happened around 2015, that we got a new board in Men's Forum and started to take a new approach. We started serious debates in newspapers. We got many articles published about what we were seeing. We started making an event on the 19th of November. You all know this date. It's the 8th of March, just smaller. It's called Man's Day. Anyway, new members found their way to Men's Forum, and in 2016, our own helping service called Kamerathjelpen was born. In plain English, Kamerathjelpen is a buddy help, someone who understands the next guy in a similar crisis. I will point out that Men's Forum has 6 female helpers today, out of 62 helpers. And over 10% of our members are women. Today we are being taken seriously. We base our voice on research, but of course also what we see and hear from our members. We will reach over 5,000 inquiries from everything from people in a life crisis, researchers, journalists, politicians, and of course Nordic Consular Minister Office in Lithuania. And in children disputes, we help out fathers in great numbers on how to leave the conflict. John Barry talked a little bit about this. We see the problem as a huge problem in society, but we developed a way to take people in life crisis in a situation where there's a parent conflict, it goes to court. We take them totally out of the conflict. We make them safe. We make the court understand what is the actually, how do you say this? What is the quality of this father trying to just want to be with their child? What is his actual qualities? So he can speak about this, so he can understand how to actually say this in a language that the court and children's service and all the other understand him. Because just being frustrated and want to be with your child is not accepted. That's just a huge conflict. So Men's Forum's main goal in Norway, beside helping people in life crisis, we want a new Children's Act. We want it to end the battles for children. The children surely get scarred for life, and also the parent. My own child's 2 children were scarred for life from this outdated act. And I'm going to leave the story of Men's Forum short, because I'm going to tell a little bit about statistic. In Norway, it shows that parents' violence against a child is equal for a man and a woman, for a mother and a father. But for every mother who gets left alone on a monthly basis from her child, it's 80 fathers. And this is a really sad statistic. And 90% of those fathers, when asked, are not in this situation by their choice. That means we have around 30,000 fathers who wants to be there and cannot. I get emotional and I'm sorry. The man, of course, get to be the parent in a huge conflict that gets sidelined. It's very easy because we see all the people involved in understanding the situation, understanding the children. It's 90% women working in all these groups, except judges, of course, but it doesn't really help too much. So I got a little bit out of script and I get too emotional, so I will do it short. Yeah, so I will stop talking about that side of the story. We're really fighting for this, and we also fight a lot for mental health. And yeah, I'm going to go to a short presentation of something that's happening in Norway today. It's called Men's Equality Commission, and it's put down by our government. And a leader of our organization, Men's Forum, is sitting in this committee. And the commission will start in 2022, and in March of 2024, they will try to express what is necessarily, how do we have to approach men and men's health and other issues in society. And it's, yeah, there is, how many? 16 people in this commission. It's scientists, it's, yeah, it's all kinds of people sitting there. And they're putting all their different focus on their experience and research that is done, and trying to see what we can do to make it better for men in our society. And this is a very interesting thing happening, and 2024 we will see the results, what they suggest. And then it's up to the politicians, again, as always, to find a way with what they know. So I will keep it that short now. I have more, but no.
Thank you. Thank you, Ole. And now I will invite Antanas Grįžęs from Lithuania to share his thoughts and experience. Yep.
Hello, everybody. I'll try to be the shortest, to give the shortest presentation in this conference. Let's see if I succeed. So I represent men's tribes. We are originally from Lithuania. In Lithuanian, we are called gentys, but we are moving international now. And what we do, for the most part, is we develop self-sufficient peer support groups for men. We develop them, we coach them, and then we let them live their own life for free without facilitators. That way we can scale, that way we can have a big impact, and we can reach a lot of men. Our focus for now is the informal community care as a really missed opportunity to reach men and to have an impact. Because we know that men are, as John Barry and others talked, that men are more willing to go to community-based support groups. And we try to develop this bridge between men who wouldn't consider therapy and introduce them to psychological services with easy access and as least stigmatizing as possible. But in the near future, we are planning to reach out to other services as well. So, for example, a man comes to us as because he wants community to have a peer support group, but from there we can identify men who need additional specialized services and we can provide them. So that's the plan in the near future. And our scope to date, we are operating for 3 years now, so most of our groups are in Lithuania, but we're already spread around Europe because we have a lot of Lithuanians living abroad. And just this year, we launched a very first English-speaking British group in UK. So we are very proud of that our model is really working in other countries as well. And we have planned with Gatis, who will also be speaking here, to develop the very first Latvian men's group from our model. And we have almost 2,000 men in our programs and almost 200 groups operating all across the place. And why we think we are effective at what we do, a lot of these things are what Professor John Barry already mentioned, is that first of all, we try to communicate the positive view of men and masculinity, and I think this is essential if we want to reach men to hear the message we want them to communicate. Also, we use the approach of positive psychology to frame the difficult questions inspiringly. For example, we don't say, go and get help, go and get fixed. We say, dare to go on an adventure of self-discovery. We use that kind of phrasing, which is compatible with usual masculine scripts and supports it. And also, we are peer-to-peer and community-based, which we know that men often prefer, and we promote active participation of users, not just passive consumers of services. We had an article published in Center for Male Psychology that was founded by Professor John Barry, so if you want, you can have a look at a QR code link. So that's it, a short presentation. Thank you.
Thank you, Antanas. And next presenters will be presenting from the seats. Yeah, we see John, and I will ask Gatis to share his experience.
Yes, hello. My name is Gatis Midrovskis. I'm from an NGO based in Latvia called Fathers, or Latvian Tēvi, and our organization was founded in 2015 from a social campaign called Being a Father, It's an Art. And as you saw before, in Latvia we have these social campaigns, and they're quite pretty and interestingly made, and that's one big thing that we are doing. Also, this organization mainly was created to promote the role of involved fatherhood. Of course, most of us know the impact of fatherlessness, or what's actually the impact of involved fathers, that they are so beneficial to children, so beneficial to their partners, and actually they are very beneficial to themselves and also the society. So we have also created 2 research papers. The first one was about the role of fatherhood, how our society sees it. The results were that more than 60% of Latvian society thinks about fathers as a helpful addition to the family, and the core is the mother and the child. The other research was about divorced fathers, about these, it was called Dads on 13%. So figuring out why dads are left to spend time only every other weekend with their children. That's 13% of their lifetime. And yes, one thing is that we are promoting involved fatherhood. Also, we are having courses, and we're educating fathers. They are new fathers, they are teenage dads. We support divorced fathers, of course. And those fathers who come to us are mostly the ones that mostly are actually really, really good dads, and they just want to be better. they are new fathers. A lot of them, I would say, even majority, is the ones that have second child who is about 2 or 3 years old. Those who have children, you know how children behave when they are 2 or 3 years old. It's very interesting. Yeah, we educate them on child development. We practice communication skills with children, with their partners, and these are universal skills that they're learning. We also talk about emotional intelligence. The interesting thing is that if you try to teach men about emotional intelligence, what will they say? This is not for me. But if they need to learn emotional intelligence for their kids, to teach their kids emotional intelligence, for that they have to learn it themselves. Aha! This thing works. And 90% of people that come to us, and we have surveyed, say that they would like to have better relationships with their own father. It includes relationships where they didn't have a father. The father was absent, or the father was physically there, he wasn't emotionally available. Abusive fathers, etc., etc. And these men, and I would say practically all men, all fathers, would like to break this chain. And I would say we are a generation of this generational chain that was, let's say, fatherless. Even if they were physically there, they were not available. We are changing this. And for that, I'm really, really grateful for what Nordic countries are doing and sharing their experience, and what Lithuanian government and organizations are doing and sharing, and it's helping also us. So thank you very much.
Thank you, Gatis. And then let's go to the scene, Jonas Kekkonen.
Hello, I'm Jonas Kekkonen. I come from Finland, from Miesakit. That means a bit disorganized groups of men. And that's the beginning of our story. We were really happy to host a meeting in Helsinki. I hope you learned something from there. And I was invited here to talk about the gaps. And usually the first gaps that are found in all the systems, whether we talk about Malawi or Japan or India or Canada, are divorces and violence. If you are not filling these gaps in your services, you are not doing well. The divorces are a problem because there's male-specific aspects to divorces as well as violence. Usually the violence work begins with the perpetrators of violence. And later on, every society begins to notice that there are also men that are victims of violence. And then services for those men will come around. But that's later. Begin with the perpetrators, go from there. And that's how Miesakit was working. We had to work from 1995 to 2016 till Finland was ready for first services for men who had experienced violence. The same goes for example, men who had depression and small children. Our first services have been around since 2017, and these are our services from Miesakit NGO. Society needs to be ready for the services, but those services must come from the needs that the men themselves have in that society. For example, when we were beginning our services for immigrant men, we were looking out for the services that they needed. And the immigrant men said that we need mentoring for Finnish work life, and we need men teaching us Finnish. So we have those services for immigrant men, and they work wonderfully. We tried different methods that they weren't interested in. That didn't work at all. So you can try things that men are not interested in and that are not beneficial for the men, but, well, you're just treading water that won't help you at all. I have two radical thoughts from Miesakit. The first one is that most of the people are good. And if you are working through that lens, you'll get great results. The other one is that, as Bo said, are you talking about men or are you talking with the men? We have made our services such that men come into our services. We say that this is a service for men who are perpetrating domestic violence. And men come in, no one forces them to come in. They come in and say that I want to change. And we say, great, what's going on? And then we listen and then we say, okay, what do you want to change? And they tell it. And then it's their change. It's internalized and they are ready for it. And very few people drop out from our services because we are talking with the men. And they know that we don't have ulterior motives. We are not trying to force any ideals on them. We are working for their well-being. And in Finland, unfortunately, we have huge gaps in our system. For example, psychotherapy that is supported by the government is such that 15% of it is used by men. And it's used in southern cities with most educated men that could afford it anyway. So too many men are going through this safety net that we have built, and men's services should reach out just for those men that are dropping through our safety nets. And those men that go through the safety nets are not that interested in anything else. They are interested in their own welfare, and they are interested in their children's welfare. And you can use those tools to get them in and help them. And if you want something else like equality, that's a byproduct that comes from working with the men's well-being. When they are feeling good with themselves, with their surroundings, then they are able to cooperate with other people. And our organization is such that 15 years ago we were a bit of pariah. But during these 15 years we've been working with officials, and now we are basically revered, for example, by divorce counselors throughout Finland, because we make things so much easier. Because men trust us. It's a bit stupid, because our workforce has the same education as their workforce. They are talking about the same things, but our male-specific approach and that we have men talking to men makes it such that the men are able to take the message in. And so their work will be easier, the fatherhood will be saved, probably. They will be having a better divorce. Even their exes will be pleased that the men sought the help. And this is what we get by cooperation. I have no idea how it would work without that. At least in Finland, the only signs that we see is that if we force men to come to services or we have ulterior motives, the dropout rates will multiply, at least triple-fold. So I advise you to be cunning and submit to the thought that some of the changes that men will bring will not be predictable. But as long as you trust the process that men who are well, men that feel good, will bring good to the society, that will come about. I can't predict what they will bring to the society. And it's not my job to do that. And I don't think it's any other organization's job to do that. But for example, what we need from fatherhood in 10 years is something that should be determined by those young fathers. And we should give them the skill set to be what they want to be. Because that's a beautiful thing and that's a productive thing. So let's go for that. And as has been discussed here, let's see each other's models. Let's get to work. No more discussions. We have so many examples throughout Europe. And if you want examples outside Europe, we can get that to you too. But now it's time for work, not time for research or discussions anymore. Because men are not that different throughout the world. Their needs are simple, not always, but at least the basic crises are similar. So let's get to working with those crises and helping them.
Thank you, Jonas. So maybe we stand up and go work. Yes, that's now. Yes, just no, kidding. We have work to do here on these chairs. Maybe we continue what Joanna started about talking about gaps, and gaps you talk about your country. Maybe we can hear gaps in other countries, the gaps of mental health policies and what you see and maybe experience in your organizations. So just please share what are those, and then we try to work it.
Yes, I can see that in Sweden we talk about men's violence against women. That's it. We don't talk about men's emotional health or mental health. That's not on the agenda. So we have like a fixed agenda. And that doesn't invite men into the table to take part of it and to discuss. And I think that's not good. It needs to be changed. So where are the Swedish politics here? I think this is something we need to address. So I am very grateful that we talk about it here today, and also learning a lot about these peer groups and things like this, which I think is one of the solutions. We need to work on different levels in society, from school, from the preschool to school in sexual education, and for the young men's, and all the way up. So we have a lot of things to do.
Yeah, thank you. Ulf. Who's next?
Yeah, it's working, yeah. We fill up a big gap just with these divorced men and some divorced women coming to us. But gaps when it comes for children to learn about mental health, the gap is huge. It's not in our schools yet. There are fixed programs, many different ones that can be used. 2 are tested in Norway at this time, from 6 to 13 years old. It's been tested out in some small places, and of course it's working. We already know that because it's already been tested out, the same thing, before it was translated to Norwegian in England or Canada, or it's getting already old, but we're not still trying to implement it. The politicians has been asked specific about this in Norway, and they say, not at this time. So we have something, but we don't use it. I figure out, like, I was 39 years old when I really went face down after a divorce and couldn't see my children, had to go to court, got bankrupt in that in the same order, and everything went to shit, to say it really easy. I had no experience. What is hard, crazy, anxiety when you have this, all the feelings I had, I mean, it was so much experiencing all this. I was 39, I couldn't cope with this. And then I think about young people who scratch themselves because of all the same pain. Who is taking care of those people? Are we learning them anything yet on how to understand this? No. It's a huge gap. Yeah.
Thank you.
Yeah, I can also add my 2 cents, gaps in services for men. Yeah.
Yeah, in the
so
policy.
at least the gaps that our organization tries to fill is one is male-friendly services. Period. That's it. I mean, at least in Lithuania, this is an unrecognized term in its own. Like, what does it mean, male-friendly psychotherapy or male-friendly psychological services? Why should it even be considered? So it's a new concept to begin with. And I think this is an important gap. But because we see that men tend to seek mental health less often, we need to start thinking about male-specific and male-friendly services of mental health. Another gap that we try to fill is low threshold mental health services that we try to do, the community-based, less stigmatizing services, so that it wouldn't be that if I want to help myself, if I want to work on my issues, I need to go to, I don't know, a hospital, to a psychologist, to go to a registration, but more informal types of mental health services. These are needed, and at least that's a need we try to address. And looking broader, perhaps through messages in the media and stuff like that, when we talk about gender equality, if we would start, when talking about gender equality, to start this conversation from the talking about and pointing out the discriminations that men experience, we would have a better chance at reaching men and collaborating in this project of gender equality. So I think that's also a gap to this day.
Thank you.
Yeah, in Latvia, I also see something actually really, really similar. Let's say there are two gaps. As previously said, in Latvia, we don't have a systematic approach for men's health and actually men's issues at all. We're doing it ad hoc, and a couple of organizations dealing with and doing what they can, trying to survive. And the other thing, other gap is this: we have, let's say, plenty of services, but they are not targeted at men. They are not talking in man's language. It's totally different. As we heard today, it's a different approach, so that man can easily on-ramp on it. It has to be targeted to men. As we've seen in the study trips in Sweden and in Finland, they are the same services, just marketed or targeted to men. So that's quite a big gap, and that's a thing that I know that we are going to do in near future, hopefully.
Thank you.
Well, there's always the greatest one. There's a problem with boys and education systems. In Finland we have the best girls in the world. That's something that we can brag about, but then our boys, yeah, they are lagging far behind. And that's something that is not only our problem. And that's something that we may not have solutions for here, but producing solutions for that should be part of this whole equation. Because if the boys are not ready, if the boys even can't read documents, if they can't understand language that is spoken to in bureaucracy or in science or even newspapers, well, they are dropping out of the society, and they are really hard to help if they are 30, and we notice that. So that's something. And well, if I may say something positive, it's that these are generational changes. So you don't need to create the change in 1 or 2 years. If you have a grassroots change, it will bring about new positive changes in the society in 10 and 15 years. You'll notice it then. So whatever you begin, you should keep on doing it, even if not for anything else, then just that you will have a brand that men will begin to recognize and maybe advocate for among other men. And after that begins to happen, you have something positive going on within the male community. And that's what really works.
Okay, thank you. John, maybe you can, or maybe you have something to add from England?
Yes, please. I think the fundamental gap, and maybe it's because I'm a psychologist, it's what William Collins has called the empathy gap, the gender empathy gap. And what he refers to there is the fact that we tend to have more sympathy for women if they're having a problem than we do for men, even if they're having exactly the same problem. And this seems to be something that's probably going to be quite hard to shift. And I think probably quite easy to fall into a pattern that we seem to be in now of not really seeing when men are having problems. We're hypersensitive to when women have problems, and that's lucky for women, but for men, it's bad luck because there's an empathy gap there. And I think part of this, the shift and change that will affect everything is people just starting to recognize when they're being kind of put in a position of not being able to even see that men are having problems. For example, I said about these policy-making organizations, when they're measuring gender equality, they're actually just measuring disadvantages against women. They're completely blind to disadvantages facing men. When you use a different type of instrument, there's a Gijsbert Stoet, who's at the University of Essex, has developed a different type of instrument. The only difference being that it actually measures any disadvantages against women and also disadvantages against men. You start seeing the world in a different way. You start recognizing that men have got health issues and social issues and, things we talked about with fathers having such really severe problems and these being passed on to children in a way that's hard to even quantify. But what we really need to do is to, I think, really start to decide that we demand that we're not being put in a position where we ignore the problems that men are having, because we get that quite a bit. I mentioned just that particular thing about policy making. One thing I noticed that in the BBC was very good at reporting just one side of an issue too. I found that I still do find it quite frustrating that we do get partial information, and this often leaves out the male part of the equation. Sometimes it plays up the male part of the equation. When men are doing something bad, you tend to the perpetrator tends to be identified as male. When it's a woman doing something bad, we tend to sort of make allowances. We say, well, it's the circumstances that have created her behavior, and that's there's research evidence for this. There's experimental evidence. If you give people vignettes, little stories about men and women in perpetrating crimes or being the victims of crimes, and if you leave out what the gender is, people will assume that the perpetrator is male and the victim is female, even if the vignettes are loaded in such a way that the correct answer should be that the perpetrator would be female. So we do have a lot of I think there's a way to go before we start to do that, because not trying to be negative now, but I think that will be a difficult thing to shift, because I think it is very easy to put women and children first and leave men to one side.
Thank you, John. Okay, we talked about problems and gaps and stuff very sad. It's like energy is low. Let's talk about something positive. How your organizations. We already know how organizations increase some services for men, but there's a question, how you reach those men, and because every organization maybe sometimes struggle to reach those men. So, what are the strategies, the concrete maybe strategies, how you do it, and what is successful, what is not so successful, and who wants to share? Who have the biggest number of members?
No, but I think there are some doors in, or gateways here. We had one previously here. We talked about sexual problems or relationship problems combined. That's one way in, to get men interested, and also in education in school, to learn more about consent and sexual education, and also to understand what's working, what's not working. I think it's quite simple. Men loves education in some way. Young men love to learn things that's practical, that I can use, and I can see that I can move forward. So I think schools are very important to involve in this. I also see that the CRISE, as a CRISE center, We need to be there where there is a crisis, there is an opening, there is a gap that we could get in and reach them. So there, instead of having like a negative attitude towards crisis, see the crisis as an opportunity. And also the fatherhood, which I think every man wants to be a better father than the father he had. Even if you're really like criminal or whatever you do, you have an urge to be better father. So that's also a way in to develop and to start develop your consciousness enough to take new steps in life, and also to take care of yourself. We don't take care of ourselves. That's a big thing also.
Okay, thank you. It's just I would like to do one segue from your answers. Maybe some of you knows about education at school. As we know, a lot of teachers are women. Yeah. And when we are talking about education, about mental health and all this sexual health and etc., is there some kind of maybe research studies that boys could take more information and get influenced more by men, or it just doesn't matter? It's just the most important that the information would be interesting and on the spot for them. Maybe someone of you have some kind of ideas? John? Can you?
Turn off the mic. The research is a bit mixed. It depends on the countries to some degree. In terms of grades for boys, it doesn't seem to matter that much whether it's a male teacher or not, although there's a lot of anecdotal evidence that boys tend to respond better to male teachers because male teachers understand boys a bit better, having been boys themselves. So they don't interpret boys' behavior as being, say, defiant. They might just think that they've got more of a restless energy in them and that they need to use. But I think that the whole issue about education it's incredible how it's fallen off the map of everybody's consciousness. And I'm not sure that, I think what we really need is when we talk about, like, I think people expect male teachers to be role models for boys who don't have role models at home. And I think the solution is we need role models at home. We need, dads at home. We need better ways of keeping families together. We need, like in the UK, the legal system is accused of being a bit too eager to split up families. And I think we need to keep families together and happy families. That's what we want, happy families, not negative families. But boys do, as has been pointed out by the panel, boys do so much better in a home. And it's better for the boys, better for the dads, better for the mums, better for society, better for everybody if you've got a good dad in the home.
Thank you, John. Then I will ask you to continue with good practices, how to reach men.
I have the dullest possible answer, resources. When we had 7 workers, we didn't reach that many people. Now we have over 20 workers that are full-time. We have a dozen workers that are part-time. We have over 100 volunteers. We reach plenty of men. We have offices in 6 cities in Finland. That makes a huge difference. We have enough resources to have all our services available online, by phone, locally. We can have support groups in different formats and hobby groups in dozens of cities and towns in Finland. So it doesn't just happen. You need resources if you want to have enough time there. That may be unfortunate, but there's no way around it.
And can you share experience? The resources are not only money, yeah? It's also in people. So those who are working in the teams and in the centers, it was easy or I don't know, difficult to to attract those people who would work in the centers?
Well, we have an easy time. Non-governmental organizations in Finland don't have much to offer. Our salaries are not good, but we have ideological workers. They are there because their heart tells them that they have to be there. And we can be good employers so that we can be flexible, we can take their life situations into account, and that is really something that is appreciated, at least by Finnish men. And when we have that longevity with workers, we can have trust by men because we have faces for our services. You need to be a good employer to have that. And then we have men who come in and say that, yeah, my stepfather stopped beating us 15 years ago when he came here, so now that I began to beat up my family, I knew where to go. And they know who to trust because we've been there and we've been the face of this for long enough.
So it's a better start now with less resources than wait for the more resources and then start like big and through all the country.
If you wait, you're just not creating the brand, you are not creating the trust.
Okay, thank you. Who would like to add something?
Yeah, I just want to say that my experience from group therapy is when men really found this useful and that they grow, they want to give back. So there is a lot of men who really wants to, what can I do for you? What can I participate here in some way? Fortunately, we are not organized in that way, but there is usually not any problems to find people who wants to work after they've been in contact with these organizations. I think you have the same experience.
So it's a trust, like
yes.
Trust. If I trust services and people who provide services, I maybe would like to participate myself.
Yeah, and if you experience this is a value for me, I have grown, I've seen things, I handle my life in a completely different way. I want to share this. I want to give it away, give it further to others.
Yeah, thank you.
So our organization focus is, I would mention 3 points. One is to be positive about our message, about our invitation to the services. As I mentioned earlier, we try to focus on the positive aspects of self-discovery, of psychotherapy, of counseling, and that's why we kind of avoid such terms as crisis and stuff like that. We talk about it definitely inside the groups, but we don't necessarily, it's not our starting point. We try to inspire people, not to give them pain when they see our advertisement. We're trying to inspire, like, yeah, that's something I would want to do. Sounds exciting, sounds cool. That's the reaction we're trying to bring up in them. And what helps, one thing that helps is, of course, using the positive aspects of masculinity, like be brave, go on a challenge, go on an adventure, dare. Yeah, so we use these kinds of words which are traditionally, conventionally associated with traditional forms of masculinity. And also we use this banter that John was talking about. We use humor in our advertisements, and for example, we use a lot of Facebook ads, and under those ads you can find a lot of comments from guys commenting on our ads, and of course they're going to banter with us. They're like, what kind of cult is that? Like something like that. And we banter back. We don't ignore them. We are not serious with our answers. We banter back. And that's how we connect with them. Actually, they start respecting us because they see that we are okay with taking a joke. We're not very uptight. And the last thing, which could sound a bit controversial, I think there is some, I don't know, stigma, maybe if it's the right word. There is some stigma of prioritizing the more economically advantaged population first. But I think that could be the key to the cultural shift, because the hard to reach men are usually, at least in Lithuania, but I guess in all the countries, The hard-to-reach men are usually above 40 years old, living in the rural areas, single and alcoholic. Yeah, it's very hard if we, from the onset, we try to reach those men. Our focus, our organizations, our starting point are the young hipsters living in the capital city. Yeah, that's our starting point. They're the easiest to reach. They're the most open to the idea, and they can pay for the services because we are not a non-profit. Guys need to pay for our services. But from there, we can create a cultural momentum, a cultural shift, because we start communicating with a healthy part of men's population. And if we can convince the healthy part of population that, hey, it's actually quite cool to take care of your mental health, come and join us. And they actually do. In men tribes, most of men, they are super proud of being part of our organization, and they openly demonstrate it in their social media accounts and stuff like that. From there, we are creating a cultural shift where those hard-to-reach men start considering joining us. And of course, with development of our services, we're more able to propose cheaper and more accessible services.
Okay, it's still like developing a broader approach. Now it's more younger generation and...
No, we actually, that was just an example. It's not like tribes, majority of tribes participants are just young hipsters. But we actually have, the majority of men are above 35 and, with children, with families. But I just wanted to contrast those hard-to-reach men versus the young guys.
Yeah, so the gap, I think, that everywhere is a countryside and far away from the capital city and from other bigger cities. Yeah, that it's difficult to reach those men. You have, Jonas, different...
Well, going online is really effective because everyone has a smartphone nowadays. And then again, if you have groups that are, for example, we have Teams-based groups, Microsoft Teams, they can reach them from anywhere. And then we've been pushing our services so that we have live groups in Kainuu area, which is the least well-off area in Nordic countries. Yeah, I'm from there. We have highest numbers of schizophrenia and alcoholism. Yes, even Greenland can't compete. And we've been going to the Sami area in Lapland, and it's just you need one person there that is really inflamed with your ideas, that really loves what you are doing, and he can create a group around himself, and it begins to spread from that. But you need to have someone who believes in that positive change.
Yes, that's very important to have few person who believes and also they want to do the work, because it's not easy work to reach all the men.
Yeah, our experience is that we help somebody and they want to help. They get safer, they feel they're in a community, they have a lot of different people to reach for different problems they have. Because we have specific people in Men's Forum that all the local so-called leaders, like in a big city in Norway, they know about this network. So some new people come in. One thing is what the local group, when they physically meet, does. And maybe they got in contact with some new friends there in the local group. But we see that suddenly we can pitch them like, oh, maybe you should call this guy, he could be nice to talk to. And of course, so we put people together, and then it's more and more things are happening. So we have 8 local groups in Norway now, and we're planning to just grow and grow this now, because we get more and more members and more people get interested. It's really self-sustainable at this point. It's just going to grow. That's our experience. Yeah.
So you don't need any campaigns?
We would love money. Oh my God.
Okay.
We do this volunteer. We've been doing this for 11 years. Nobody make any money in Men's Forum. But we do a lot. We have, 3,000-4,000 hours last year. Meeting, talking to people. That's a lot.
Yeah, that's a
Volunteer,
lot.
yeah.
Yeah.
We would love money.
But do you have some campaigns for publicity, like advertising, as Gentis has?
Yeah, we have a little bit. We use Facebook commercial. But you know, the word spreads. Many times I'm on the hotline. People call in and it's like, yeah, I heard about. Some friend told me I should call you guys. You know, that's how it goes now.
Yes,
it goes by word.
It's more word of mouth. Yes,
Yeah,
yeah.
And it could be anybody. It could be a grandmother, because you know, grandmother will call us also with her grandson. Don't see her grandson, whatever. We have. It's just not for fathers what we do. It's for the whole community. We have young men coming to us. They don't even started a family life. I think the youngest one coming into our group was 16 years old. He had a lot of questions, but we not started something big for boys yet. But we try to speak of boys in our work to the politicians and to society. We speak about what we see with boys. We call it officially in our group the boys' crisis. It's coming hard, and we try to give it a name because we see the result of 20-ish years with little contact with fathers who actually wanted to be there for their, especially boys. This will leave some big gap. And what we also see, we can pinpoint it because we can see when different laws were made, what impact they had for children. When was it more beneficial to have a child alone with you than share it? When did new rules come? And you can see spikes, you know, but now the real consequences get out there because now they're over 20, many of these kids. And it's really interesting to see things like this. We can just use when different lawmaking was made, and then we see actually challenges happening. It is hard to tell the politicians because they made these laws. Maybe their party was supporting it and they don't want to talk too much about it. But we can see some challenges there that is obvious, yeah? So, yeah.
So you reach your members through mouth, like word of mouth, and it's spreading like a virus.
It's a virus now. It's a movement. Some researchers came to us and they wanted people from our group to talk to them, and they want to do more study now. And actually, Finland is paying for this. It's from the university in Stavanger. It's a co-thing from Norway, Sweden, and Denmark. No, Norway, Sweden, Finland. Now they want to see what happens to all these children when they get older. This is what we've been talking about for some years now, and now they want to do the science. But it's interesting also because in Sweden, they have doing science like this for over 10 years. They've checked many hundreds of thousands of kids. How does it actually go if there's a parent conflict, if the child lives with one parent, if they don't get divorced? And the numbers are so clear. It's one of the biggest research on this, I'm guessing, in the world. And it's our neighbors. We should be looking at Sweden, yeah? So, yeah.
Yeah, thank you. Got this.
Yes, I won't tell you anything new. I would say, yeah, the things that we heard are two, mostly. The first one is being an ambassador. I like this term, or being a node for change. Someone that spreads this great virus. I would say that I could be called a poster, not child, but poster man for this thing, as 4.5 years ago, when my first daughter was born, after 2 weeks or something like that, I got into this NGO Fathers and got into a fathers group. It practically changed my life, and it helped me understand and fight my depression. It helped create such strong bonds with my now 2 children. It helped me create really loving relationships with my wife. It created plenty of such loving relationships also with a lot of men. And now I'm leading these groups, and I see the changes in those specific men, and it's so needed. And a lot of men are like this. They want to see change and they want to make change. So be the ambassador. And you know what? The other thing is, let's put resources in those ambassadors who want to work and spread this healthy virus.
That's a good advice.
Yeah. So, of course, we talked about role models, which I think is a very important when we talk about how young men construct their identity. And of course, a mature father, present, is the best. But as we know, this is not always there, you know. And we're not going to change everything in society, so we need to provide with role models in some way. And I think one way is sports is almost everywhere, and I think to have the organizations involved in sports, footballs, ice hockey, whatever you have, to have them, educate them to really take on to be the role model of good masculinity. Because we see that sometimes very immature leaders of causing bad stigmas on kids, you know, or they get really frustrated because they are not coached in a proper way. So I think if we could educate the instructors and leaders in the sports region to actually take on to be a good role model, that could add to this, to young men.
Thank you. John, maybe you could summarize and add a little bit from the scientific review or your knowledge a little bit. The most effective, have you seen in the studies, most effective way to attract men to organizations, to men's organizations, and try to involve them in that kind of work and self work?
Yeah, the research, unfortunately, I mean, whenever I'm communicating with anybody about men's issues, I always have a sense that there's the professional people who who I initially wanted to make aware of these issues, but who are often kind of a bit deaf to what is being said. And then there's the more community level things that are happening that are really just taking off. And these aren't being researched very much. I mean, they're not being researched in the way that, for example, a deficit view of masculinity is being researched. You know, there's plenty of there's a whole massive industry dedicated to that sort of research, generating negative views about men. But actually, the positive stuff is happening right here, and this is brilliant. I mean, this just to hear this and just know that things like this are happening all over Europe. I mean, this is fantastic, and there are things analogous to this happening in the UK too. So I think this is taking care of itself. You just need to have men who are not encumbered by negative views about themselves or about, you know, what fatherhood is. You know, people who realize that you've got to value men as human beings. I mean, first and foremost, that's what you need. Just men who are free of these negative views. And so, in a way, I think we've already cracked the problem. We just need to scale it up and keep it going and kind of spread the word a bit. I'm still concerned about the other aspect of what I do, like my professional colleagues, who are much, much slower about this. And unfortunately, there's a lot of people who are making decisions that affect everybody, and they're stuck and much slower about changing things. If we could get the kind of change happening that's happening on the ground to happen in, you know, when I showed you the socio-economic model, you know, we have the individual level and the community level. If we could get these sort of changes happening at the higher and higher levels, you know, it would be a game changer, and everyone would be happier. Nobody's happier. Nobody's made happy by spreading negativity about people, like whether it's men or women or whoever. You know, it doesn't work for anybody. Nobody's happy when you know, domestic abuse happens and it doesn't get resolved properly, because nobody has any proper idea about what caused it in the first place. They make assumptions that it's some sort of, you know, a symptom of patriarchy or something ridiculous like that, rather than saying, look, these are people, these are relationship issues going on. It might have roots based on their own experiences as growing up. You know, we need to. So, in one way, I'm hugely optimistic about what's already happening on the ground. On the other hand, I just think it's so slow what's happening elsewhere. It's like it really is two different worlds. I realized that very early on. That's the hardest work is talking to my professional colleagues and to other people in different sorts of organizations in those higher levels.
Okay, thank you, John. Now, audience, maybe you have questions. You have time, maybe you have some interesting ideas to share, to ask.
So, probably it will be not so much question, more like remark. Because during your discussion, like number of times I had criticism, thoughts. I even do not know how to put it, like to system or to services, because they lack of sensitivity for men. And all services which were mentioned, we basically know that women are majority of employees, social workers, teachers, medical services, child right protection services. And my question is, so why women are present in those sectors? Why men are not coming to those sectors? And actually we have here gender inequality issues very strong. So basically it's look like a little bit, you know, that we are, how to say, we're not taking attention how structural gender inequality works. And then, at least for me, it was like women are guilty that they are not sensitive enough for men's issues. Even if, for example, if we ask women if they are satisfied with medical services or other services, I would say women face the same problem, that we feel that not always system is sensitive enough for issues which women face. Yeah, so here is, for me, it's a little bit controversial, you know, to hear that system is not sensitive. But at the same time, I do not see any initiative from men's side to just to run in that field, you know, to take places and to provide services for men as they deserved. Empathic, sensitive, and, you know, responding to the requirements.
It's a very good remark. Who would like to comment? Please.
It's very interesting you say this, because in Norway we have a lot of, in the education field, we have like extra points for women, so they should choose higher education, and also some education that was more been represented by men before. We had the system for many years now. But to the, so we're getting women to higher education and to some education that was more male-based at the same time. But we should probably do more in the other way, where there is a lot of women, child services, and of course we should get men this way by doing the same thing. But there are only 2 or 3 courses in Norway. Men get extra points today, but I think there is around 90 where women get extra points to get this education. So what's happening? I think here we can do a lot, yeah? That will change it, because we cannot expect I don't know how many men we did in Norway to fill up the, in kindergarten to get it equal there. But as a lot of men, we cannot expect them to just come and take this education. We have to get them there. And politically, we already do this to women for many years in Norway. So why can't we not do the same for men, This is my, yeah.
Yes, someone else want to comment?
Well, in Finland we have much more segregated workforce than in any of your countries, so I can't tell you anything about that. But in Finland, the sensitivity on male-specific issues has been getting so much better. For example, one of the cursed places for this was our prenatal and postnatal care system. They made so many mistakes again and again and again. They really pushed the fathers away. But this was in the beginning of this century. Now they have been training each other, and men's organizations have been training them, and feminist organizations have been training them to get the men to participate and have the skills needed. And now they are much better. So this is something that can be taught, and it's not just something that men's associations should do. It's something that everyone should do to create better services. And it has been happening. It's a delight to go and train them. I've been doing it for 16 years, and it's getting better each year. So keep on doing it if it is needed. And it doesn't need to be non-segregated to work.
If I might add, I completely agree that what we need is training. We don't need to kind of coerce more men to be nursery school teachers or things like that. We just need people to be trained to understand that the sensitivities of the job, basically. So I completely agree. Training, when I've spoken to therapists about this, there's so little training in sensitivity for therapists, so like whether psychologists or counselors, psychotherapists, very, very little of it. And it's not a big deal. I mean, in a way it is. And I think the key is having true empathy for your male client, like really understanding, what it is like to be a man living in the world, going through particular hardships, for example. But we shouldn't, I don't think, be trying to force people into occupations that they don't want to be in, because that won't work. I mean, there's a lot of research looking at what's called the things people difference between men and women. Men tend to gravitate towards more sort of hands-on, things-orientated jobs, and women tend to gravitate towards more people-orientated jobs. Now, that's not them being forced into it. In fact, in countries where you have more freedom to choose whatever career path you want to go into, you find that men and women tend to opt in to more gender typical, what some people would call stereotypical, but it's actually people's choices of style of work. We should just, I would say that one of my basic principles as a personal thing is just encourage people to be and achieve, whatever they can, like be who they truly are. And you will tend to find that there's kind of these sort of gender differences will tend to play out when you allow people to do that. And there will be people who don't fit into the kind of the usual gender types. But I think we shouldn't be trying to encourage people to do gender atypical things just because we think it's the right thing to do mathematically to get 50-50.
Thank you, John. And thank you for a question that was very intriguing. Who is first? Sorry. Okay, Bo.
I just want to add that, like your question, and I think if we are going to develop boys, we need to make them more sensitive, more emotional, clever, more emotional democracy, as I said before. And if we can create that, maybe more boys will join these workforces in hospitals, in schools, in such situations. So I think you are perfectly right, but we need to change from the start and up with sensitivity, empathy, a more emotional democracy.
Thank you. I just want to build on what you were saying. I fully agree, and I think gender segregation is an issue when it comes to gender equality. And we know why, because then whoever is in the minority has to deal with the imposter syndrome, with different types of harassment, discrimination. And I know this from the inside. I have my older daughter, she's an aerospace engineer and glider pilot, and wherever she goes, she's one of the two other girls, and it's very difficult. And I guess it's the same for any other boy that studies in the health or humanities or arts. So we want our kids, no matter what it is their choice, and we have to trust them for these choices here. I agree with you. We want them to feel free and supported. And I think by saying that these are mathematical calculations or gendered differences and leaving it there brings us, I'm not sure if you have seen my presentation, but it is online on YouTube, you can go backward. It brings us to where we are creating gender norms, and we are still living into these gender norms. And as long as we are not reaching this gender balance, whichever the area, the sector it is that we are talking about, then those people that are in the minority, they will never be feeling comfortable there. And I think it's about time that we get together and find solutions, so we want our kids to feel comfortable. Yeah, thank you.
Thank you. I will come back to the chair. And we are in the last minutes of the discussion. I'm very strict with the time. We can continue discussions after a few minutes in the networking part, so I think that we can share more ideas and more good practices. But now, as a last discussion, I would like to ask you just to, like, for one sentence, okay, maybe two sentences, just what you would wish for, like, men's emotional health, men's well-being in that specific area. As usual?
As usual. One thing I come across like 10, 15 years ago was to focus on attachment styles and mentalization. And that's a very psychological terms, but it's actually an extended way of empathy, where you actually are able to shift roles and really understand what the other person feels. And for doing that, you need to develop your own sensitivity to your own emotions, and then you can understand how other people experience things. This is one thing that we work in the group therapy a lot, by sharing, by listening to others, and by recognize yourself in other people. And I think this is one of what I see there is that there is a change in your consciousness and how you, in your attitude towards other people. So I will put in this as a last one.
Thank you. Who wants to continue?
Yeah, I would say that change is slow, but I see change, and I'm very, very optimistic, especially being here, surrounded by these men doing great work, helping others. And my one sentence would be, find supportive group around you.
Thank you. Thank you. And you are an example of the change, as you mentioned.
Practical, predictable services with enough resources and availability of peer support. That's one sentence. And don't hesitate to contact any one of us if you need something, because just doing it alone isn't going to make it.
Doing as a group is better.
Peer support.
Peer support.
Actually, for the past 2 hours, I must confess, I had shivers going through my body for all these 2 hours because I'm super excited of what's actually happening here today. Even though, at least live here in this institute, there are not so many of us, actually. There could be much more people here. But I'm super excited that we have this dialogue because I know there are a lot of very strong and very good experts here who are working with women's issues. And then we have very strong, very good experts who are working with men's issues. And we don't have enough dialogue between these two groups in our societies. And I'm just super grateful that we're actually having this right now, today. And we're not agreeing on everything yet. Yeah, and we're not perhaps understanding each other yet, but we're having this dialogue. And I think if there is a vision of equality, I think it needs to be like this, that here we are, men and women experts talking to each other. I think that needs to happen more and more.
Thank you.
Yeah, I'm really for this equal work. Somebody has an experience, you meet another person who has more or less the same issue. But you are on a place now today when you can actually meet them, and you will soon have an understanding between another. Many times I get this, like after a few minutes I get this, finally somebody who gets me, somebody finally who understands me. You can talk about empathy here, like Barry say, but this is because they understand, I understand them. And this concept should be made more, should be almost everywhere. It's very easy, it's low thresh, should be some, not crisis center, but local centers pushed around, you know, where you actually can meet up and talk to somebody who had issues before, who went through it. This is what I want a lot of, yeah. I believe in this idea, but I believe in everything I hear here, but yeah. Yeah.
Thank you. And John, maybe your one sentence too? Can you unmute John? John, maybe you can. Yeah.
I feel honored to get the last sentence on this, even though I forgot to unmute myself. I would say a general principle in therapy is, you know, it's good to speak about how you feel. Often we're told that men should say what they feel, and then we say what we feel, and then we wish we didn't say it because we don't get a good reaction. I would say be brave, say what you feel, and if you can find groups like that are represented by the panel here, groups of men who've got goodwill, go to those groups, say how you feel, be with other people. You can all talk about these things, get it off your chest. You'll feel much better. But I think it's killing people not to be able to open up and say what they think and truly feel about certain subjects.
Thank you, John, and thank you all of the panelists. Thank you all. We can maybe make a round of applause. Thank you, and you can sit here. We will spend a few minutes. I would like to invite. For concluding remarks, Marianne Berger-Marjanovic, Senior Advisor for Gender Equality and LGBTI, Nordic Councils of Ministers.
Thank you very much. I've been given the difficult task of trying to summarize and to reflect a little bit about the messages and all the knowledge that we've heard today. And I would like to just start by thanking you, because this has been extremely insightful, very strong speeches, and a lot of very good input that I'm sure that we can use both in the Baltic countries, in the Nordic countries, and also in the Nordic Council for Ministers as a platform for this work. So I'm very grateful for that, and thank you also to the moderator who has been trying to energize us and to giving us also the room to reflect together, which I really appreciate. When we heard the Vice Minister from Lithuania speaking earlier today, she was highlighting certain aspects that I thought was quite important. She was asking for solutions and for practical examples and ways for developing this work further. And I think that she also recognized the bravery of the NGOs and the importance of the men's organizations and crisis centers and clinics in the various ways that you're organized, that this work requires bravery, and she acknowledged that. So I think that was quite an important point. The Secretary General, she was talking a little bit more about how masculinity and involvement of men is an essential and very integrated part of the gender equality policy work in the Nordic region. She also spoke about the importance of capacity building and the strengthening of networks of the men's organization, which this project was one of the initial thoughts of this project, to build these networks in the Baltic region and in the Nordics to exchange. And I think we see that this has been really one of the good outputs from the projects. And also the British Council highlighted the importance of fostering the dialogue and the involvement both locally and regionally, and to foster a culture for greater mental and emotional well-being. From the first keynote speech presented by Aige, it was really clear to me that this stereotypes and how gendered stereotypes occur and how it looks like throughout the whole EU was really interesting to see, and with reference, of course, to the Gender Equality Index. And what was highlighted in this speech when it comes to the challenges that are specific to men and inequality is, for instance, the fact that men spend longer hours at work when you look at the EU average, and that men are not eligible for parental leave in some cases. In the Nordic region, this is going in a good direction, but that's not the case for the whole Europe. There was also raised the concern about men's health, and also stressed that both when women and men experience violence, men offer violence from other men. Women often experience violence, for instance, from an intimate partner. And also highlighted that men are more likely to commit suicide than women, and that this psychosocial stress is a really important factor in this. Also, in Christian's speech, it was stressed the differences in men's health and the prevalence of emotional distress and depression among men, and also the need to reduce the health inequalities. And I found that particularly interesting because this is also one of the goals of the Nordic Gender Equality Cooperation, is actually to actively reduce health inequalities. And I think he also pointed at a very promising methodology when it comes to working in this specific area. From Latvia, we heard about the challenges when it comes to work-life balance, and also the specific problems of divorced and single fathers, and how Latvia has been working with these issues, also fighting gender-based stereotypes, and also using gender mainstreaming as a very active component in this work. From the Danish participant, I would also like to highlight that I found it very interesting, this reflections on the shift from before and after the Me Too movement, and how there may have been changes also in national policies as a consequence of this, that men's issues that previously has been addressed by anti-feminists are now more an integral part of also national gender equality policies. And he also referred to some of the legislations that has been happening recently in Denmark. During the panel discussion, it was also raised a lot this discussion about approachability and availability of men's services, and the strong importance of speaking not to men but with men, and the need for special clinics and special services devoted to men's issues. And this also implies that men's centers start to function as a center for expertise that can be useful also to other parts of the health system or other parts of other systems for educational purpose. And when it comes to the question that you raised about what governments can do, it was referred to the fact that you need to work in several different sectors. It's not sufficient to work within the healthcare system. You need to work with this as a horizontal perspective and pick up on this in many different ways, and particularly also within the education system. And also that it needs to be a long-term perspective on when you want to change stereotypes. It really is a long-term work. Yes, and one other issue that has been mentioned by more speakers throughout the day was the area of stigmatizing, both the stigmatizing of perpetrators can be a problem, but stigmas are connected both to perpetrators and also to victims, and that it's important and relevant to also be talking about bystander behaviors. I will now return to the second keynote speaker who gave a very extensive presentation of the current research that has been done and which is currently being done on men in therapy. And when you talk about barriers and obstacles, he stressed that masculinity can sometimes focus and overshadow other factors, such as, for instance, distrust to therapists, to confidentiality concerns, to the finance of these services, or geographic availability of these services. and that there is really a strong need for a therapy approach that is based on men's communication or way of communicating and the need for empathy. And I believe that was also picked upon in the panel later. So in the final panel discussion, it was also a really extensive and good presentation of best practices, I would say. It's been really inspiring to hear how you work and how this is really representing different models of working with these issues. It was quite evident for me that that you have you have kind of grown from different specific issues. Some are related to child care and divorce issues. Some are related to mental illness, and some are related to perpetrators of violence. But in some way, I thought that you all described very good models and ways of working. So I would really just repeat and to say that this is very useful also in the work that the Nordic Council of Ministers will continue to do. The focus area on men and masculinities will go on throughout this year, the next year, and we are also currently developing the new cooperation program for 2025 to 2030. And this, what you have brought forward today, is very valuable input also to this work. So, thank you.
Thank you, Marian, for concluding remarks. I think that you worked the hardest today, because you need to conclude everything in one space. So thank you for this work. Now the formal part is over. We will have a networking part. We can share our experiences one-on-one or in groups. In the back of the auditor, you can see the brochures from the organizations. Thank you for those who were participating online and here. So thank you for everyone and panelists and John from UK who was online. See you next time, and let's everyone be more sensitive to each other and ourselves. Thank you.
Det ble bare bestilt til meg, og det var jo de som bestilte det her. Ja. Det er mye klart fly, liksom. Guys, it's been a pleasure to meet you. Thank you very much. Yes, of course. Well,